following bills. H.R. 1259, the dextromethorphan distribution. No, we were going to do the other ones. I just said you will do all of them and just do unanimous consent. Distribution Act by Representative Upton. H.R. 1246, the Early Hearing Detection and Intervention Act, Representative Capps. H.R. 1253, the Health Insurance Restrictions and Limitations Clarification Act, Representative Burgess. H.R. 20, the Melanie Blocker-Stokes Mom's Opportunity to Access Health Education, Research, and Support for Postpartum Depression, Representative Rush. H.R. 307, the Christopher and Dana Reeve Paralysis Act, Representative Baldwin. H.R. 479, the Wakefield Act, Representative Matheson. H.R. 577, the Vision Care for Kids Act, 2009, Representative Green. H.R. 756, the National Pain Care Policy Act of 2009, Representative Capps. H.R. 914, the Physician Workforce Enhancement Act of 2009, Representative Burgess. Without objection, all these bills will be considered as read and open to amendment at any point. Hearing no objection, that will be the order. I'd like to ask unanimous consent to proceed on all of these bills, but before we do that, I want to recognize Mr. Barton for some comments.
Thank you, Mr. Chairman. I want to say, as I said in my opening statement, we appreciate the bipartisanship of these consent bills, the 9 consent bills that are before us today. I have agreed with the motion that you just made that we consider them together so that we can move on to the tobacco bill, which will be a little bit more contentious. I do want to engage you in a, not necessarily a colloquy, but at least something of a dialogue about the bills that deal with the NIH. As you well know, in the stimulus package that the House and the Senate just passed and the President signed, there is $10 billion, that's B, $10 billion in additional funding for NIH. This includes $8.2 billion for research, $500 million for facilities, $1 billion to renovate a university biomedical and behavioral research facilities, and $300 million for instrumentation. This is a 34% increase in the baseline of the NIH budget. I have no idea how this amount of funding at one time is going to impact the NIH, and I would hope that you would agree with me that before the NIH begins to obligate these funds, we should call the NIH directors and the political appointees that have already been appointed to the NIH before this committee to do an oversight hearing and get some input on behalf of the committee about how they intend to use this amount of funding. I'm told at the staff level you agree with this approach, and I would just like to get your comments on the record on this.
Gentlemen, you would yield. I support your concerns that we require NIH to explain how they plan to use the funds appropriated to them in the stimulus package, and I think it would be appropriate for us to have an oversight hearing on this very subject. So I look forward to working with you.
I appreciate the chairman's input and take you at your word. We will work with you to schedule that hearing at a time that's convenient for NIH and also convenient for the committee. And I appreciate your interest in this. And with that, I yield back, Mr. Chairman.
Thank you very much. I evidently have taken everybody off guard by asking all these other bills to be brought up. And there are some manager amendments to some of them, which have been shared and for which there's no controversy. So if there's no objection, I'd like to ask, when we ask that all the bills be considered as read, I'd like to ask unanimous consent that they be considered in block. Without objection, that'll be the order. I'd like to ask unanimous consent that the manager's amendment to H.R. 479 be considered as read and adopted. Without objection, that'll be the order. To H.R. 577, there's a chairman has a manager's amendment in the nature of a substitute. Without objection, that'll be considered as read, and without objection, the manager's amendment in the nature of a substitute is adopted. On H.R. 20, there is an amendment by the chairman. Without objection, it will be considered as read and adopted. Without hearing any objection, that will be the order. Now I would like to ask unanimous consent that the in-block consideration of all these bills be put to a vote. Yes. Okay. These are all very good bills. We used to have a chairman of one of the appropriations subcommittees who used to stand up on the floor to present his subcommittee appropriations bill. And he'd stand up and always open his comments by saying, "This is a very good bill, if I don't say so myself." And I think that was the only thing you were able to understand, because the rest of the time he mumbled.
That was Mr. Whitten, and it was
reserving the right to object.
Yes. I recognize the gentleman on his reservation.
Well, thank you, Mr. Chairman. I had prepared amendments on the issue I alluded to in my opening statement, that being the issue of transparency.
Yes.
I do not wish to encumber these bills with that issue, and you and I have had private conversation on that. And I would just like to see if my understanding is correct, that the chairman is willing to commit that we will have a hearing on the overall issue of pricing transparency so that this may be appropriately presented to the committee without having to do so in the context of each of these individual type bills.
If the gentleman will permit, I do agree that we need more transparency in healthcare pricing. Getting appropriate information to consumers is important, and we want to make sure consumers have information that's timely, comprehensible, and useful in their decision-making. When we address healthcare reform, I think it's an appropriate place for us to look at this kind of information and to have a panel to testify at one of the hearings. And I will work with you as the ranking member and Mr. Pallone as the chairman of the subcommittee in fashioning such a panel. If the gentleman would permit, I want to yield to Mr. Pallone.
Well, Mr. Chairman, you said it exactly the way I had suggested it to Mr. Deal, that we definitely need to address this. It's something that's important to me, and we would either have it as part of one of the health care reforms hearing over the next couple months or consider it separately, one or the other.
Mr. Chairman, I would obviously prefer that it be dealt with separately, because I don't want the issue to be ignored by other equally important issues in a single panel. So I would ask you both to consider the possibility of a separate panel addressed to that issue. But with that, I withdraw my objection, and I will not object. I yield back.
Thank you. I appreciate your request, and we'll talk further and see if we can work it out. I was about to ask for a vote on all the bills combined, but Mr. Stupak is here, and he wanted to be recognized, and so I wish to recognize him at this time.
Well, thank you, Mr. Chairman, and thank you for recognizing me. I just want me to say a few words on H.R. 1253. The legislation that we have with Mr. Burgess does one simple thing. It requires healthcare companies to be upfront and honest on their policies, when they place limitations, restrictions on benefits prior to the point of sale of their policy. Currently, because of the way the regulations were set up, many Americans were unaware that their health insurance may not cover injuries resulting from certain recreational activities because their policy is unclear or overly broad. This lack of clarity has created a confusing situation for individuals that may ride snowmobiles, horses, ATVs, ORVs, or participate in other recreational activities. While millions of Americans enjoy these activities safely every year, when an individual is injured, they often do not find out that their insurance will not cover their medical expenses until after the injuries. Our bill, H.R. 1253, would require that any limitations and restrictions on benefits be explicit and clear. Insurance companies should be required to make available to participants and beneficiaries in an easily understandable manner a description of the limitations and restrictions included in the policy. By passing this straightforward legislation, we will protect our constituents that may ride motorcycles, horses, snowmobiles, ATVs, or participate in other recreational activities from being caught by surprise when they thought their policy covered any possible injuries that may have resulted. I encourage all my colleagues to once again vote for this legislation as we did last session. I ask unanimous consent to place in the record a letter of support from the American Motorcycle Association. I want to thank Chairman Burgess for his work on this legislation, as well as you, Mr. Chairman, Mr. Waxman, and Mr. Barton. And I yield back balance of my time.
Thank you very much, Mr. Stupak. Any further debate on the unblock amendment? Mr. Upton?
I would just like unanimous consent to put in my well-written statement, and to save time, we'll just insert it. It is bipartisan. I thank you for putting it on block. It's the third time. Hopefully it's the charm for the Senate to act on it.
Thank you very much. Without objection, the gentleman's well-written statement will be substituted for his previous statement that he was going to put in the record, and will be part of the considerations for today. Mr. Burgess.
Yes, Mr. Chairman. In the interest of time, I would also like to submit my coherent and lucidly written statements on both this bill and on 914 for the record, and ask that they be considered.
Without objection, that'll be the order. Any further discussion? If not, the vote comes on the unblock amendment. All those in favor say aye. Aye. Opposed, no. The ayes have it, and the motion is agreed to, and all of those bills are duly reported with the usual instructions. Now we'll return to the tobacco legislation, H.R. 1256. Without objection, the bill will be considered as read and open to amendment at any point. That will be the order. And let me call for amendments to the bill. Mr. Boyer?
Thank you, Mr. Chairman. I have a substitute amendment at the desk.
Mr. Chairman, I reserve a point of order.
The gentlelady from Colorado reserves a point of order.
And I...
Just 1 minute. The clerk will report the amendment.
Amendment in the nature of a substitute.
Without objection, that amendment will be considered as read, and the gentleman from Indiana is recognized.
Thank you, Mr. Chairman. Due to significant concerns regarding the legislation before the committee, I took the chairman's legislation. I worked from it to develop a substitute amendment that I offer here today. My substitute amendment maintains many of H.R. 1108's provisions while establishing a practical and workable regulatory framework which will better protect our children from the tobacco use and significantly increase the public health. Most importantly, the substitute acknowledges a continuum of risk among all tobacco products. As the American Association for Public Health Physicians and many others have stated, a huge body of scientific literature clearly shows that smokeless tobacco products, depending on the product, range from 90% to 99% less hazardous than cigarettes in terms of risk of tobacco-related illness and death. My substitute provides a regulatory oversight for the development of products that reduce the risk of death and disease due to tobacco use while ensuring that all tobacco consumers are fully and accurately informed by HHS and others of the relative risks of tobacco and nicotine products. My substitute enhances tobacco prevention and cessation programs while adding these important harm reduction strategies which will greatly assist our efforts to encourage Americans to stop smoking. The American Council on Science and Health has found that the established health risks associated with smokeless tobacco users are vastly lower than those of smoking. In the past 25 years, almost 80 peer-reviewed scientific and medical publications have acknowledged the differential risks between cigarettes and non-burning tobacco products. Many are concerned that encouraging the use of smokeless or nicotine products as an alternative to cigarettes is a gateway to more tobacco use. The facts, though, in the United States and Sweden do not support this. In 1991, a national survey revealed that 1/3 of adult smokeless tobacco users were former cigarette smokers, and an earlier survey showed that young men who had smoked cigarettes and subsequently used smokeless tobacco were twice as likely to quit smoking as cigarette users only. We must give Americans the information they need and deserve in order to make informed health decisions. In doing so, we will move them along a continuum of risk and drastically decreasing their health risks associated with tobacco use. I intend by this to create a gateway of combustion to non-combustible products. My substitute creates a tobacco harm reduction center under the Department of Health and Human Services. This center will house all tobacco regulation and will be streamlined and a focused agency completely committed to addressing the tobacco epidemic in our country. H.R. 1108, on the other hand, places tobacco regulation under the jurisdiction of the FDA, which we all know has its own challenges, and I do not want to jeopardize the FDA's focus on the safety of our drugs, devices, and food. Furthermore, my proposal does not include many of the First Amendment challenges included in the Chairman's mark. Therefore, under my proposal, tobacco regulation has a better chance of going into effect immediately, while the bill before us is sure to be sent straight into years of litigation to the Supreme Court. My substitute also ensures that federal authorities stay off our nation's farms. Make no mistake, under H.R. 1108, our nation's tobacco farmers will be directly or indirectly impacted by federal regulations. My substitute expressly prohibits the federal government from affecting our nation's farming practices. By supporting this substitute amendment, you will help to advance tobacco regulation policies to catch up with the science available on the issue today. Additionally, you will ensure the protection of our current FDA, the promotion of public health campaigns regarding tobacco, and the improved use of the state's MSA funds and the protection of our nation's farms from government infringement. I encourage the support of the substitute, and I yield back my time.
Thank you, Mr. Boyer. The chair recognizes himself in opposition.
Mr. Chairman, I withdraw my reservation.
The gentlelady's reservation is, on a point of order, is withdrawn. The chair recognizes himself to oppose this amendment. The fundamental approach of this Boyer substitute appears to be to prejudge the safety of smokeless tobacco and virtually exempt smokeless tobacco from regulation. And then the substitute uses the language of reduced harm, which doesn't require any scientific evidence to be there to show it there's a reduced harm, but relies instead on an unproved assumption that if people gave up smoking and used smokeless tobacco, that they would be safer. Now, I object to this approach because I believe it would cause tremendous harm to the public health, and I believe that we should leave the important issue of harm reduction to those with scientific and regulatory expertise. The underlying bill, H.R. 1256, takes a rational, science-based approach to promoting harm reduction. It does so by requiring that any claims of reduced risk or reduced harm from a tobacco product, any claim be supported by scientific evidence. This would ensure that claims are based on fact, not speculation, and I think it's one of the central accomplishments of the bill. Without that kind of a provision, we could easily face another disaster like the light and low tar fraud that began decades ago. We learned from that experience that smokers are eager to take hope from claims that a new tobacco product poses less risk. We learned the tragic results, that these kinds of claims can cause smokers who might otherwise quit to delay taking that step. And when someone decides not to quit because of claims that a new product is less dangerous, that person is not safer at all. In fact, that person is much less safe, and that's the outcome that we must prevent, and that's precisely what I think this substitute would invite. Another major flaw of the substitute is that it would remove all the provisions in the underlying bill that limit advertising and promotion to kids. This undermines one of the most critical goals of the bill, to protect children from deceptive marketing that entices them into a lifetime of addiction and disease. I understand that Mr. Boyer has First Amendment concerns. I disagree with his perspective. I cannot accept an approach to tobacco control that does nothing to end the tremendous harm caused by the industry's continued marketing to children. It's illegal for children to buy cigarettes, and I think that we ought to ask that the advertising geared to people who are not legally able to buy the product be limited. Another problem in the substitute is the delegation of tobacco regulation to a whole new agency instead of the Food and Drug Administration. FDA is our nation's chief public health agency with over 100 years of expertise and experience in setting science-based standards to protect the public health. This substitute would be a grave mistake because they would take this important task of regulating tobacco to a new agency with no expertise or experience. And finally, the bill totally eliminates the user fees that would pay for the tobacco program. In these times of an extremely tight federal budget, I don't see the wisdom of eliminating the full funding that's guaranteed under the current bill and simply hope that a government will come up with the money in some other way. So these are my concerns about the substitute, and with all due respect to my friend and colleague, urge a no vote on the substitute. Further debate on the substitute. Yes, Mr. Deal.
Thank you, Mr. Chairman. I do wish to speak in favor of the Boyer approach, and there's a philosophical difference of opinion, obviously, here. First of all, I want to commend him on the great amount of time and effort that he's put into developing this proposal. Having watched and participated in some of the discussions that he has given to our side of the aisle, he has spent a great deal of time trying to get it right, trying to make sure that he's thought of most of the major issues as he incorporated them into this legislation. I believe that the creation of another agency within HHS, but outside of FDA, gives us the best of both worlds. It keeps it within the healthcare community, it keeps it within the jurisdiction of this committee, but it does not confuse it with the issues and the underlying obligations of the FDA. So I am in favor of the substitute proposed by Mr. Boyer, and I would yield the balance of my time to him.
Mr. Chairman, if I may, you permit a little bit of latitude, and then we're going to move this really quick.
Would the gentleman speak into the mic so
Yes.
that it could be picked up by the...
What I'd like, unanimous consent, that this chart be passed out to everyone. Would that be all right, Mr. Chairman? A copy of this chart.
Copy of the chart, yes, without objection.
Yeah, this chart would be really challenging. Yeah, everybody has it? The genesis for this was a very good discussion between the chairman and I, and this is a very lively discussion, not only here in the United States, but countries around the world. Many of them are struggling with the same challenges we have about individuals that get addicted to smoking, nicotine. Now, there are two different specific types of approaches. You can have what Mr. Waxman has, which is sort of the abstinence-only approach, and then there is the other approach, which is really what the chairman and I were trying to do, was to come to terms on how to be pragmatic in the approach. And we're agreeing to disagree, I think, is what's kind of happening here. The great debate, and let me just share with you what the Royal College, strike that. Yeah, the Royal College of Physicians, quote, "Harm reduction is a fundamental component of many aspects of medicine and indeed everyday life. Yet for some reason, effective harm reduction principles have not been applied to tobacco smoking. It is very clear for most of the major health effects of tobacco, smoking is as many times more dangerous than smokeless tobacco use." Now, what I've done here is I've done something that's never been done before. I read so many treatises here since the last time we took on this legislation that I actually took the array of products that are in the marketplace, and then relative to the medical treatises, please embrace this gentleman's effort to reduce the morbidity and mortality rates among our citizens. But the real question is, his goal is to eliminate, my goal is to reduce. So you say, okay, Steve, how do we work that out? I look that out being very pragmatic, and the reason I offer this substitute is say, Mr. Chairman, among all the products that are out there, you know, I go, all right, the most dangerous is if you roll your own cigarettes or Lucky Strike. And you say, okay, those are pretty severe. The next, you've got filtered cigarettes. And then among the filtered cigarettes, you know, there's a lot of money that has gone into the effort, and the chairman made use of this about the terminology that's in the public domain. The use of descriptors such as light and ultralight. Well, those descriptors are out there, and I find it interesting that 85% of the tobacco users buy those types of cigarettes. You see, in their mind, they think that they're getting a harm reduction strategy, and the chairman's right. It's not helping them with regard to their health. But if we can actually move them through an informed ability to choose among a continuum of risk, from a public health standpoint, I think that's a good thing to do. And the public doesn't know. We make these choices every day with regard to what type of automobile we want to drive, or what type of food we want to eat, or what we want to drink. But with regard to tobacco products, the users of these things don't know. So we say, okay, if you don't want to use the most harmful, which is a non-filtered cigarette, you go to a filtered. And then of these filtered, you've got other things they try to do. The whole goal here is, can you have a, quote, safer cigarette? I think the chairman would say that's pretty difficult to do because it's not the nicotine that is harmful, it's the smoke. It's the smoke that kills. That's where all the carcinogens, that's where all the harmful health effects occur. So how do you move them as a gateway into this continuum? And what I would submit is, you know, you've got a couple other products out there. The reason I put question marks here between the tobacco-heated cigarette and the electronic cigarette is I think the chairman is absolutely correct. The science isn't there, but we do know that that is of less risk than with regard to actually inhaling that much smoke. And then we have of the smokeless products.
Gentleman's time has expired. Do you want another minute?
Can I have 2? Give me 2 and then I'll go sit down. Is that a deal?
2 and sit down. Wow. Without objection.
So with regard to smokeless, the reason I bring it down here to the 10%ers is science tells us if you move them from combustion to non-combustion, you take 90% of the pulmonary disease and carcinogens off the map. You say, okay, Steve, why the differential then between the smokeless and the smokeless snus? It's because even though we move them to a smokeless product, it's fermented. So when you have a fermented product, you still have some bad things occur just in the natural process of tobacco. But when you get to smokeless snus, it is a pasteurized product. So when you look at the Swedish experiment, they don't have a lot of the great challenges in their country that other countries are dealing with because they use a lot of the smokeless snus. Now what we have are products that are also coming out on the market called the dissolvables. These dissolvables, they don't contain the nitrosamines, and that's a good thing. Now these types of products, whether they're dissolvables, whether they're orbs, whether they're a stick, or whether they're a strip you lay on your tongue that delivers nicotine, but it has a less harmful effect. Then you have all the therapeutic, the gum, the paste, the lozenges. You've got pharmaceutical, such as Shantex. What we're trying to do, which I would love to be able to do with the chairman and maybe the end product, is that we have a continuum of risk and people are able to make informed choices among the continuum of risk. And we should be driving people from smoke to smokeless. And as we drive a population into smokeless, the last thing we should be doing as policymakers is increasing taxes on these products because we want to move a population to make it healthier. And so when you think about the 400,000, I'm getting ready to sit down. When you think about the 400,000 individuals of whom are dying each year with regard to smoking, and you look at the statistics, some of these leading treatises that say that if you actually took that population of 40 million users and said they're all smokeless, we reduce the mortality and morbidity rate to around 4,000. And this is a big deal. So please take a deep breath. I know there's a lot of paper in front of you. I'll be more than happy to answer any questions you may have, and thank you for your indulgence, Mr. Chairman.
Gentleman's time has expired. Chair wants to recognize Mr. Pallone, but would you yield to me before you get started, just to make the comment that one thing that was not on that chart to reduce the risk would be to quit smoking. You don't have to go to a pharmaceutical at the end of the line. You could quit smoking. And secondly, I want to tell people that my goal is not abstinence. My goal is to discourage cigarette smoking, but I accept the fact that adults smoke, and that is the reality. And we're not going to do anything about that except to try to discourage them, but it's their decision. Mr. Pallone, 5 minutes.
Thank you, Mr. Chairman. I must say I was kind of enjoying the gentleman from Indiana's presentation. I felt like I was back in the classroom, and he was the teacher there with the chart. But my problem with his approach and his substitute is that I don't think we should be making this decision. I mean, there's ample evidence that smokeless tobacco is, has some serious problems, causes cancer and various things. And I think that the chairman's reference to light cigarettes is a good one. I mean, actually, the fact of the matter is when tobacco, for a long time, nobody thought there was any harm to tobacco at all, to smoking any cigarettes. And then when lights came along, even today, a lot of people think that lights are less dangerous than regular cigarettes, which scientific evidence shows they're not. They actually may be worse because of the way that people inhale them and the impact on their lungs. So I think it makes sense to leave this up to the FDA and not establish a separate standard through legislative fiat when we're really not in a position to know. So that's my basic disagreement with the gentleman when it comes to the standard for smokeless tobacco versus regular cigarettes. In addition to that, you know, with regard to the advertising for kids that the chairman mentioned in this substitute, to me, one of the most important aspects of this legislation is to eliminate that advertising to kids. I remember when we were initially passing this legislation last session, I went to a elementary school in my district in Edison, I think, New Jersey, and the teachers, the principal had kids that were from, I think, kindergarten through 5th grade, and we had all the different products you know, that were advertised that we thought were mainly, you know, trying to reach out to kids. And I was frankly surprised because I thought those were mainly targeting teenagers. And I was amazed to see how, you know, little kids that were, you know, in 1st or 2nd or 3rd grade were actually responding to those ads. So, I mean, that's a very important part of this, which the substitute, I think, effectively eliminates. The other thing I would say is that with regard to this new agency that would deal with this, I am totally convinced that the FDA is the best agency to deal with this. Now, we know that, you know, the FDA is already spread too thin, and that was brought up last year, that they have too many responsibilities. They shouldn't be given additional responsibilities. But I think the answer to that is to make sure that the FDA has the resources required to do its work. And the legislation that the committee is considering today ensures that with the user fees and you know, to appropriate or to make sure that we have adequate revenue. We need to do that in general, not just on cigarettes, but in general we need to give more money to the FDA, but that doesn't mean that we should eliminate the FDA or change who regulates things. The answer is to help them out and give them the money and the resources so they can do their job. They're clearly the appropriate agency. They've been regulating foods, drugs, cosmetics, and even pet food, so there's absolutely no reason why they shouldn't be the agency that regulates tobacco, and we certainly give them the money to do so in this legislation. So I oppose the substitute for all those reasons. Thank you, Mr. Chairman.
Thank you, Mr. Pallone. Further debate. Mr. Barton.
Mr. Chairman, I rise in support of the Booyer amendment, somewhat in the nature of a substitute. I think it's clear that he has an innovative idea here. I think it's clear that he spent a lot of time researching and perfecting it and putting it into legislative language. I also think it's clear that, to take your analogy one step further of quitting, if we prevent our children from starting in the first place, then you don't have a problem later on that you've got to convince them to quit. Mr. Booyer's approach does things somewhat differently, substantially differently than the base bill. Number one, it creates this tobacco harm reduction center in the Health and Human Services Department instead of making it a part of the FDA. Secondly, it does require more funding for tobacco cessation and also prevention. As has been pointed out, of the $52 billion that has been actually sent to the states since the tobacco settlement, only 3.5% of that has been spent on prevention campaigns or cessation campaigns. And a little bit of money there would go a long, long way. Mr. Booyer's bill does that. And I know it's late in the game. I know that you have been a tremendous advocate for trying to reduce the amount of harm that tobacco does to some of our citizens in this country, and that you've been consistent and persistent on it. And I know this is a priority of yours as chairman, but I would hope you're open-minded enough to realize that there are different ways to solve the problem, and Mr. Booyer's way is a way that would be, in my opinion, much more cost-effective in solving the problem and probably do a better job of actually reducing smoking in the U.S. population and preventing children from starting smoking in the first place. So I'm going to support his amendment, and I hope that it would really be a positive step if the committee would support this, as I know how hard you've worked on it, so it's difficult to do, but this is a better way, in my opinion, and I hope we can take it. And with that, I would yield back.
Thank you, Mr. Barton. Further debate on Ms. Schakowsky. Oh, Ms. DeGette first, and then we'll get to Ms. Schakowsky.
Thank you, Mr. Chairman. I want to make a couple of comments about science here. The first one I'll make is I'm looking at this chart, which I've only just seen just now, which Mr. Boyer gave us, and I guess it doesn't make much sense to me from a scientific perspective, because it talks about relative risk for chronic disease, and then it has percentages. But relative risk is not a percentage because it's relative. So it's one thing relative to another. And so the numbers don't really correspond to any of the research. And I want to talk about that because that kind of thing is what we're asking this new agency to do. What this bill or what this amendment does is it says to the administrator of the new agency that they shouldn't take into account the impact on the population as a whole when it develops standards for tobacco products, or when it sets standards for allowing a claim that one product is less hazardous than other products. Instead, what it does is it says that the administrator shall evaluate the relative health risk to individual tobacco users, which is what this chart shows. So it doesn't show the effect of a manufacturer's actions on non-smokers or on potential quitters or the population as a whole. So under this amendment, if a manufacturer can show that a change in a product reduces the risk of cancer for the individual tobacco user for 5%, by 5%, for example, then the administrator would have to allow the manufacturer to make health claims, and those health claims would be like this will be safer for you than, say, smoking cigarettes. And the administrator couldn't take into account the fact that these claims could cause millions of current smokers to switch rather than to quit, or it could cause many young people to start smoking, thinking falsely that cigarettes or smokeless tobacco or whatever were no longer dangerous. And so the net result would be more people suffering from tobacco-related diseases. And Mr. Boyer was talking about the marketing of these light and low tar cigarettes. This amendment would have the exact effect that he was talking about, because when those cigarettes were marketed, people switched to light and low tar cigarettes instead of quitting, and others started smoking thinking that the cigarettes were no longer as dangerous as before. That's what would happen here. People would start switching to smokeless tobacco, thinking, well, since it's supposedly less risky, then they should switch to it. But in fact, if you look at smokeless tobacco, and if you look at the studies that have been done, smokeless tobacco users absorb 2 to 3 times the amount of addictive nicotine as cigarette smokers. Chewing tobacco contains 28 chemicals that are known to cause cancer. Long-term snuff users are 50% more likely to develop cancer of the cheek and gums. Smokeless tobacco users increase the risk of cancers of the oral cavity, throat, larynx, and esophagus when compared to people who don't use tobacco products. But this is the kicker to me. The average age of first-time users of smokeless tobacco is 10 years old, and that's right now, even before you shift this marketing. So if you allow manufacturers to say to people smokeless tobacco is relatively safer than smoking, I'm afraid what you'll do is you'll actually have the effect of encouraging young people and children to start using smokeless tobacco, which can have a different risk to them. And so I think this is a very, I understand what Mr. Boyer's trying to do, but it's not based in science, and for that reason we should reject his amendment. And I yield back, Mr. Chairman.
Mr. Chairman.
Thank you, Mr. Gett. Who seeks recognition? Yes, gentleman from Illinois.
Thank you, Mr. Chairman. I'd like to yield my time to the gentleman from Indiana.
I would say to the gentlelady, I was very attentive to your points that you were making until you made the very last statement, and that's where your credibility just fell right off the table. To say that this wasn't based on science, I know, and I apologize to the members of the committee, this is a 200-page substitute. And what had happened here is that I was working with the chairman. I would love for us to have had hearings on this. I would love for us to have been able to, we have 9 members of this committee who've never touched this legislation before. I would have loved for us to have embraced regular order. I would have loved for all of you to have had a chance to read this. But please don't criticize this if you don't know what's in my substitute. And to say that the chart that I've just put here, Mr. Gatt, it was not based on science is false.
Well, would the gentleman
I was
yield?
painfully, no, hold on just a second. I'll be more happy to. I was painfully accurate. Being a lawyer myself, the last thing I wanted to do is put up a chart that someone could like pick apart to try to claim that somehow my argument wasn't based in some type of factual setting. I'm not stupid. So it's based on the science and the treatises for which I have read. And what I did is, this had never been done before. What I shared to the committee has never been placed before our country. We're trying to set forth a public policy framework. And I agree with the chairman when he said, well, Steve, what you forgot to say is I also want him to quit. Well, you know, that is the very last thing of the continuum of risk. Maybe I should have put that, or to quit. But what I want to be able to do is to make sure that people have informed choices. You see, I have a pretty serious job on behalf of Congress here on the VA. All of you love to talk about PTSD. For the longest time, we believed that a PTSD veteran, that somehow we were helping them by permitting them to smoke. It calms them down. In reality, what the science tells us is that you take that nicotine and its impact upon the brain and the effect of caffeine and nicotine both upon the brain is a counterbalance against the psychiatrist's efforts to help these PTSD patients. So I am 3 years into a smoking cessation study, and we're using therapeutic and pharmaceutical means to try to get them as we help them. So I understand Chairman Waxman's desire. I understand the desire of many on the committee. But I am more than happy to explore with any of the members about this desire to make sure that we have informed choices among the continuum of risk. Now, what this bill does, it protects consumers from bad actors of smokeless products. In particular, the FDA will continue to prevent smokeless from making therapeutic claims. So I just want Mr. Gatt to know that in response to her comment. The FTC will protect individuals against false and misleading ads. There are 50 states have consumer fraud laws with tobacco products that are subject to, and the MSA has its advertising restrictions. So with that, I would yield to Mr. Gatt.
First of all, I want to apologize if the gentleman took my remarks personally. I certainly meant no insinuation on your intelligence or anything else. What I was saying is 2 things. First of all, as I read the substitute, which since I haven't had it for a long time like you have, I haven't looked at every single part, but it looks to me like the bill says if a manufacturer can show that a change in a product reduces the risk of cancer for the individual tobacco product, then the administrator would have to allow the manufacturer to make health claims. Is that correct?
Yes, ma'am.
Okay.
We're trying to, wait a second, let me reclaim my time. What we're trying to do is gateway, Mr. Gatt, from smokeless to non-combustible products. And I think that is a good and healthy thing. So what the challenge is, the base bill before us sets some unrealistic standards. So the real question out there is, it sets standards that may possibly never been able to be achieved. So that's why I call the chairman's bill an abstinence-only type approach. And what I'm hopeful that we can do here is to move populations from smokeless to non-combustion. When I do that, Mr. Gatt, I can take away 90% of those challenging health risks. As a matter of fact, the tobacco smoke is responsible for the pandemic of cancers, heart disease, respiratory disease, and other deadly results. It's the smoke. I yield to the gentlelady.
My second question, and perhaps the gentleman can answer. is how can you have a continuum of relative risk based on a percentage system rather than on a comparison system?
I'm sorry, the last thing?
If you're doing a continuum of relative risk is not a percentage. It's values relative to each other. So the question is, yeah, it's not a number. For example, if smokers are 5 times more likely to get cancer than non-smokers, the relative risk would be 5. It's not a percentage. So I'm wondering what your chart means.
The purpose of it is I tried to take the science that was out there with regard to disease groups that result for the use of certain products. And the purpose of this chart, ma'am, was really to show the pathway among choices and the fact that these users can make an informed choice among the continuum of risk. That's really the purpose of the graph.
Gentleman's time has expired. Ms. Schakowsky, do you still wish to be recognized?
Just a couple of comments.
Gentlelady is recognized.
Thank you. The substitute would exempt smokeless tobacco from virtually all regulation and places no limit on tobacco industry advertising to children. And that's the point that Ms. DeGette was saying, that 10-year-olds using smokeless tobacco. We've had, I can't remember if it was this committee or another committee, well, we've had baseball players coming before various committees of the House talking about the dangers of chewing and sniffing tobacco or snot, whatever you'd call that stuff, and how dangerous it is, and cancer victims coming and talking about that, and how this is something that we have to discourage our children from using. In a way, it seems like we've shown that methadone treatment is something that we do for heroin users, but we're certainly not going to go advertising methadone as a preferable drug to heroin and placing no limitations on it, because there is an enormous health risk. Allowing marketing of products as reduced risks, and I know you challenged this, Mr. Boyer, but without adequate scientific evidence, restricts the government's ability to increase warning labels on cigarettes, that's in the bill, in the substitute, and eliminating user fees for the program, relying solely on discretionary appropriations for funding. We're talking about products that kill over 100,000 people every year of known danger. We certainly don't want to do anything in this legislation that's going to encourage young people to engage in unhealthy behaviors. And this legislation would actually allow that to be encouraged, to allow the tobacco industry now to advertise to children. And it could be a gateway then to using to smoking, as well as to using smokeless tobacco. So I think that this is a dangerous idea, and that the idea of allowing the FDA to regulate tobacco as a drug is definitely the direction that we want to be going in, and I support Mr. Waxman's legislation.
Are we ready for the
Mr. Chairman?
question? Yes, gentleman from Oregon.
Thank you, Mr. Chairman. I yield to my colleague from Indiana.
Thank you very, very much. A couple of things I would like to bring up as I was listening to Ms. Schakowsky speak. It's interesting. I brought this up with the chairman in our personal discussions. Hold on, if I may. It's interesting how we get ourselves, even by political party or even ideology, on the opposite side in a paradox. And what I mean by, in the issues of teenage sex, or how do we improve public health and try to stop the spread of AIDS? Now, you can have an abstinence-only approach. When conservatives talk about an abstinence-only approach with regard to teenage sex, a lot of my Democrat colleagues mock that position. And you mock that position by using a harm reduction strategy and about education And you also, so when their concern is with regard to the spread of AIDS, you even advocate the needle exchange. And so Chairman Waxman and I had a very good discussion about this, and I complimented Chairman Waxman with his leadership when he chaired the Health Subcommittee and helping the country through a difficult time and dealing with AIDS and moving in a harm reduction strategy, not only just on the spread of AIDS and doing needle exchanges, but also with regard to we'll talk about another pandemic, and that is sexually transmitted diseases. And I don't want to embarrass members on this committee, but it's very easy to pull out your statements. And I've read some of the statements that some of you had made with regard to these issues in attacking abstinence-only positions. So my only appeal to you at this moment in time is don't lock yourself into an abstinence-only approach with regard to use on tobacco.
Would the gentleman yield for just a second?
Sure.
To characterize Mr. Waxman's bill as abstinence only would mean that we prohibit the use of tobacco. That would be to make tobacco illegal. You couldn't buy it. That's what abstinence only is. This is not, his bill is not an abstinence only piece of legislation.
Reclaiming my time, his bill is an abstinence only approach because he sets very unrealistic standards in which can be set by manufacturers to create smokeless products to move people in a gateway along the continuum of risk to ultimately quitting. And so when you set those unrealistic standards that cannot be met,
Gentlemen,
then it becomes an abstinence-only approach. I yield to the Chairman.
Well, I don't agree with your designation of my approach as an abstinence-only. I'm pleased to hear Republicans admit abstinence-only programs don't work. But give me an example. How does this bill make it difficult for someone to do anything other than use tobacco or quit?
One in particular, Mr. Chairman, reclaim my time, is that the bill you hamper the ability of manufacturers to even talk about their products.
To make claims.
Well,
it may not be valid claims.
If we want to be able to promote and move people, for which we know even now, if you look at epidemiological studies that are out there with regard to, it is a known fact that smokeless tobacco products are less harmful than smoking. That is a known fact. And if we want to move people through that gateway, I think it's extremely important that manufacturers are able to have people make informed choices, especially if we want to move them to dissolvables. There we know that we can take away almost 98 or 99% of the risks. So, you know, I'm going to go back and say this to you personally, Mr. Chairman. I think you were right in your, let me just read this. Here's your quote. You said, quote, "The statistics are shocking. A few weeks ago, the CDC released data showing 1 in 4 teenage girls in the United States has a sexually transmitted infection. 30% of all American girls become pregnant before the age of 20. For African Americans and Latino girls, the rate is 50%. And thousands of teenagers and young adults in the United States become infected with HIV each year. If we're serious about responding to these challenges, we must base our policy on the best available science, evidence, and not ideology." And that's my plea here today, is for all of us to make this public decision. Don't ground it in an ideology. Let's ground it in a framework that we can move a population along a continuum of risk and make our society healthier.
Gentleman's time has expired. Are we ready for the question?
Yes.
Oh, gentleman over here, yes.
Thank you, Mr. Chairman. I just wanted to say that I am supportive of the amendment in the nature of substitute by Mr. Bouya, this Youth Prevention and the Tobacco Harm Reduction Act. And I have not read all 200 pages of his bill, but I do appreciate what he's trying to do. Mr. Chairman, I do appreciate what you're trying to do and what you have done over the years in regard to this, because as a physician member of the committee, clearly I understand the goal and the need to try to eliminate smoking almost 100% if we could. But as my colleague right here to my right, Representative Scalise, said in his opening statement, the FDA is really, in my opinion and our opinion, not the place for this, because the FDA is charged with removing from the market any harmful product. And clearly, everybody knows at this point that cigarette smoking, nicotine, the smoke, the tar, whatever, is harmful to one's health. So, as Mr. Booya said, in contradiction to Ms. Schakowsky, that it is eventually, I think that if we pass this bill, your bill, that the FDA would have no choice but to ban cigarette smoking. And then what happens? Then my concern, Mr. Chairman, is that these people who are hopelessly addicted, the adults, will get black market cigarettes from other countries that have much more impurities and nicotine, and they would be...
Gentlemen, yield.
To the Chairman, of course. Of course I'll yield, Mr. Chairman.
Well, the bill specifically prohibits the FDA from banning cigarettes. That isn't going to be an option. The bill also provides that if the FDA, based on science, finds that there is some risk reduction product, that they will approve that. And I'm saying it without the exact language. But I'd rather have the FDA make that determination than for this committee to decide we want people to use smokeless tobacco.
Yeah, Mr. Chairman, reclaiming my time, and I understand that point, but what I'm saying, it just seems to be an oxymoron to put the FDA in that position. And the other thing, too, if you get to the point under this bill that the amount of nicotine has been reduced so much that these people that are again, hopelessly addicted, they very well might smoke twice as many cigarettes a day or 3 times as many cigarettes a day just to get that required amount of nicotine to satisfy the addiction. So, again, I have some concerns over that. I would say to my colleagues that in comparing what Mr. Booya is talking about in this harm reduction in smokeless tobacco, I think one of my colleagues on the majority side said that, well, you know, oral cancer is also a bad thing. It is, no question it is, and we know some personal situations about that, but clearly it's not as life-threatening as lung cancer. Lung cancer, my colleagues, unfortunately, is almost a death sentence, whereas squamous cell cancer of the lip or tongue or cheek is not, thank goodness. But this is why I say I think the approach that Mr. Booya has, and at this point I'd like to yield to my good friend Mr. Booya.
Just for a second, the Chairman, you asked a really good question with regard to who's going to be informing whom. The reason I choose and create a harm reduction center within the Health and Human Services is so we get out of this whole debate about the FDA. We know that FDA has a lot of challenges in its present responsibilities in regulation of drugs, devices, and food, and we get out of that debate. So we create a separate center, and that center then has the authority to rank the risk of tobacco products based on the sound science for which we all have a desire for it to have. With that, I yield back to Dr. Ginry.
And I thank the gentleman for yielding back. And just
in
conclusion,
gentlemen, yield to me.
I'll yield to the gentleman from Texas, Mr. Hall.
Yeah, I have the same pangs of conscience, I think, that you have, and that many of us have, and perhaps the chairman has. I voted with the chairman's bill last time, but I think it's of record that in World War II, they furnished cigarettes to guys that were overseas and were wading ashore in the battles over there. And there are many of them still alive that are hooked on cigarettes. And under this is my understanding that they'll not be able to get them. And that's the price I've paid for voting for Waxman last time. I've had a number of those people that talk to them. And there's a good many people of mid-age and average age of Americans that are hooked on cigarettes,
well,
that are badly affected
time
by not having the right to do what they want to do, even they don't know the consequences. That's the only thing that worries me about it. I don't even know how I'm going to vote yet, but I thank you and I thank the chairman.
Mr. Hall, reclaim my time, and I realize, Mr. Chairman, my time is just about elapsed, but if I could make one last point, and I appreciate very much what Mr. Hall said, but again, Mr. Scalise early in his opening remarks said that if you have this tobacco under the control of the FDA, then basically people get the idea that, you know, the FDA has given its stamp of approval then, hey, this is okay. So, I mean, I think it could, but I would say, Mr. Chairman, in closing, that if it wasn't for Mr. Booya's amendment, I would be very much inclined to vote for your bill, because I think you are definitely trying to do the right thing, and I commend you for your heart and working toward cutting out smoking, particularly for our youth. And I yield back.
Thank you. Gentleman's time has expired. Are we ready for the vote?
Mr. Chairman,
Who seeks
20
recognition?
seconds, Mr. Chairman.
Yes, gentleman from Texas.
Thank you. And hopefully this will be the last comment. I cannot take credit for this observation. It's really Mr. Inslee's. In speaking about abstinence and maybe the connection, Mr. Inslee made the observation that if we did practice strict abstinence, there may be less smoking. And I think I understand the connection.
If the gentleman would, since the gentleman has time, I just wanted to make one, well, are we ready for the vote? All those in, Chairman will restrain himself. The vote now comes on the Boyer substitute. All those in favor of the Boyer substitute will say aye. Aye. Opposed, no. No. The noes have it. The amendment is not agreed to.
Mr. Chairman, I would ask for a recorded vote.
Okay, we'll proceed to a recorded vote.
Mr. Waxman?
No.
Mr. Waxman votes no. Mr. Dingell? No. Mr. Dingell votes no.
We don't ban cigarettes.
Mr. Markey? Mr. Boucher?
People can do what they want to do.
Mr. Pallone?
It's the way it is.
Mr. Pallone votes no.
It's
Mr. Gordon?
their decision.
Mr. Rush? Mr. Rush votes no. Ms. Eshoo? Mr. Supak? Mr. Engel? Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mr. Doyle? Mr. Doyle votes no. Ms. Harmon? Ms. Harmon votes no. Ms. Schakowsky? Ms. Schakowsky votes no. Mr. Gonzalez? Mr. Gonzalez votes no. Mr. Inslee? Mr. Inslee votes no. Ms. Baldwin? Ms. Baldwin votes no. Mr. Ross? Mr. Ross votes no. Mr. Weiner? Mr. Weiner votes no. Mr. Matheson? Mr. Matheson, no. Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton?
Yes.
Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Shadegg? Mr. Blunt? Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich votes aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry votes aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mrs. Myrick, aye. Mr. Sullivan? Mr. Murphy of Pennsylvania votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Ms. Blackburn votes aye. Mr. Gingrey?
Aye.
Mr. Gingrey votes aye. Mr. Scalise? Mr. Scalise votes aye.
Are there members who wish to be recorded? Yes. Mr. Boucher.
Votes no.
Mr. Stupak.
Mr. Boucher votes no.
Mr. Stupak votes no.
Mr. Stupak, no.
Mr. Engel.
No.
Mr. Engel votes no.
Ms. Capps.
Ms. Capps votes no. Mrs. Capps votes no.
Yes. Mr. Gordon.
Mr. Gordon, no.
Any other member wish to be recorded? Anybody seen the light and wishes to change their vote?
I can ask you that.
If not, the clerk will announce the vote.
On that vote, Mr. Chairman, the ayes were 18, the nays were 34.
Yes, 18, no, 34. The amendment's not agreed to. Are there further amendments? I'll look to this side. Seeing none. Let me announce that we are going to be voting pretty soon. So members, please get the priority for your amendments. We will come back, but I don't think we want to spend the rest of the day on a lot of amendments. And I might also indicate even the new members have already voted on this bill, even if they didn't vote on it in committee. So the chair will recognize further amendments. Gentlelady from Tennessee.
Thank you, Mr. Chairman. I do have an amendment at the desk.
Clerk will report the amendment.
Amendment offered by Mrs. Blackburn of Tennessee. Strike Section 102 and insert the following.
Without objection, the amendment will be considered as read, and gentlelady is recognized to explain
Chairman,
it. Gentlelady from Colorado reserves a point of order.
Thank you, Mr. Chairman. As you are aware, I'm going to offer and then withdraw this amendment. But I do think it's a good amendment. It is a good government piece of legislation, and it does focus on strengthening the SINAR amendment and existing programs to prevent illegal tobacco use. And we all know that the SINAR amendment was put in place in 1992. The stipulation there on federal funds until a state met an 80% compliance rate for preventing tobacco sales to minors. All 50 states have met this rate, and the work product that is being distributed now would strengthen and give the opportunity for that to be strengthened in the states, because SINAR has been very successful in lowering the teen smoking rates. And the amendment would seek to reduce the noncompliance rates from 20 to 10% over the next 10 years. And it also encourages states to use their master settlement funds for tobacco control and cessation efforts. And if the state fails the SINAR goals and also does not spend at least 10% of its MSA payments on tobacco-related projects, then the HHS Secretary could withhold those funds. And it also requires posting of the ingredients in transparency in tobacco products to a website within 48 hours in order to encourage transparency. Now, Mr. Chairman, I am one of those members of the committee that has served as president of my local lung association board, and I have actually held cessation clinics and have worked on cutting teen smoking. I can think of nothing more harmful and nothing more encouraging to teenagers to pick up a cigarette and smoke than giving the product the FDA stamp of approval. And it is sorrowful to me that we are heading that direction. I do not think that policy-wise it is the wise step, and indeed a poll from Zogby shows that 63% of all Americans have concerns about what this would do to teens and teen smoking, and I think that we should be very careful as we look at giving that FDA stamp of approval. We have a program, the Sign Our Amendment program has worked. It has lowered teen smoking rates. This is something we want to see happen, and yes, indeed, Mr. Chairman, we join you in wanting to make certain that teens do not take up the habit of smoking. But indeed, though it appears we're not heading that direction, I would seek at this time to yield back my time to withdraw my amendment, and thank you for your consideration of at least hearing us out on that point. Yield back.
Gentlelady withdraws her amendment. Are there further amendments? Gentleman from Michigan.
Thank you, Mr. Chairman. I have an amendment at the desk.
Without objection, the amendment will be considered as read, and that the gentlelady from Colorado
Mr. Chairman.
reserves a point of order. And I'd now like to recognize the gentleman to explain his amendment.
Thank you, Mr. Chairman. And unfortunately, claims have been made about this legislation that it will not impact FDA's current mission, and I supported this bill the last time based on some of that information. Unfortunately, it just simply isn't true. While much of the bill's tobacco regulation at the FDA will be funded through user fees, there is a provision in the bill that allows FDA general funds to be diverted for tobacco regulation. That, to me, poses a lot of questions that we should answer before moving this bill along. At the time when the FDA is strapped for resources and failing in many of its core missions, this provision is simply unacceptable. Mr. Chairman, you have rightly criticized the FDA's poor track record on food safety. The most recent outbreak of salmonella, which sickened over 600 people and killed at least 8, was the latest tragic example of the FDA's failure to protect our nation's food supply. You and many members of this committee have correctly asserted that the FDA needs more resources to carry out its critical food safety mission. Last year, Mr. Chairman, you were quoted as saying, and I quote, "Food safety is one of the most neglected functions at the agency. The FDA is facing a funding shortfall for food safety of crisis proportions," which proves to me, Mr. Chairman, you are as wise as you are handsome. This amendment would ensure that the FDA has the resources to ramp up food safety inspections before it undertakes tobacco regulation. And I think if we're going to have a sense of priorities in this Congress, we need to make sure that the things that we know are jeopardizing the lives of folks who have no control over it get taken care of. This is certainly one of them. It would require the Secretary of HHS to certify that the FDA is able to inspect at least 10% of our nation's food supplies, a reasonable goal. Last year, the FDA inspected roughly 6,000 of the 189,000 food facilities under its jurisdiction. It's just about 3%. My amendment would ensure that the FDA increases food inspections to at least 10%, or about 19,000 facilities, before diverting any general funds to tobacco regulation. And I'm just going to go down the list of some of the recent ones over the last few years. And unfortunately, the list is growing. There was a novovirus for green salad, lettuce, and fruit. Salmonella for sprouts, green salad, tomatoes, and melons. E. coli for green salad. And most recently, we know the peanut butter incident that 600 sick, 8 dead. This is a crisis. I can talk to my kids about cigarettes. It's pretty hard to say the Surgeon General warns you ought not to eat peanut butter. I mean, this is critical to the nation's food supply, and I would strongly urge, knowing how important it is that we get people to stop smoking, it is that much more important that our food supply is safe. I would encourage the adoption of this amendment. I think it's reasonable. It's something that we can support. And it doesn't say no to your bill, Mr. Chairman. It just says we have priorities that we must meet that impact every single household in this country. And I would yield back the remainder of my time.
Chairman, I withdraw my reservation.
Gentlelady withdraws her reservation. Gentleman yields back his time. The chair recognizes himself in opposition to the amendment. This bill provides for a user fee to provide funding for the FDA to do the job of regulating tobacco, and it does not take away money from the other FDA responsibilities, a major one of which is food safety. We're going to deal with food safety very soon and try to make sure that FDA has the resources. But that doesn't mean that FDA shouldn't be able to take on the job of regulating tobacco as under this bill. So I would urge opposition to the amendment. Are we ready for the vote on this?
30-second response, Mr. Chairman, if I may.
Mr. Terry, or either one of you. Do you want to yield your time?
Yeah, I will yield my time if you.
Okay, gentleman's recognized. For
Thank you, Mr. Chairman. I would like to yield time to Mr. Rogers, specific to clarify which features are handsome.
Thank you, Mr. Chair. Thank you, Mr. Terry. Mr. Chairman, I just want to refer to you at page 142. I'm going to quote from the bill. Until such date, other amounts are available to the Food and Drug Administration, excluding fees collected under this subsection, are authorized to be made available to pay for costs described. It says in your own bill that, in fact, money will be diverted from this bill to when we pass this bill, this law. And I would strongly encourage, I'd be willing to work with the chairman to exclude that language, but obviously we haven't had much success in that cooperation. And I understand your intent. As I said, in the past I voted for it, but this bill clearly states that money from this bill will be diverted if this bill passes, and I yield back my time to Mr. Terry.
Mr. Stupak?
Mr. Chairman, if I may, I'll be brief. For the last 3 years, we've headed oversight investigations, done the food safety inspections. The problem with the gentleman's amendment is a couple of things. Number one, is he talking about domestic food suppliers, or is he talking about foreign? We're really weak on foreign. Number three, every time we've given the FDA money, like 2007, extra $10 million, they used the money, it was for food safety, they used it for bonuses for their top political appointments. Third point, in the President's budget that was just submitted to Congress, there's $1 billion dedicated to food safety. So until we get an administration that's willing to put the money behind the effort that we do need in this country to inspect food facilities, I think the amendment is just trying to draw us off the attention here, which is tobacco. So I'm going to oppose this amendment. We should put more money into food safety, absolutely. Drug safety, the FDA needs a major overhaul. So you can throw all the money you want at it, but if you don't have proper leadership at the top, nothing's going to happen. This president has put forth $1 billion for food safety in his proposed budget. So I would ask that we reject this amendment.
The gentleman yields back his time. All those in favor of the amendment will say aye. Opposed, no. No. The noes have it, and the amendment's not agreed to.
Mr. Chairman, I'd like a roll call.
You want a roll call vote? Clerk will proceed with a roll call vote.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell? Mr. Markey? Mr. Boucher? Mr. Boucher, no. Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Rush? Ms. Eshoo? Mr. Stupak? Mr. Stupak votes no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Mr. Doyle, no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Inslee? Mr. Inslee votes no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall. Mr. Upton. Mr. Upton, aye. Mr. Stearns. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Boyer. Mr. Boyer votes aye. Mr. Radonovich. Mr. Pitts. Mr. Pitts votes aye. Ms. Bono Mack. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Murphy of Pennsylvania. Mr. Murphy, Pennsylvania, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Scalise. Mr. Scalise, aye.
Other members wish to be recorded. Mr. Matheson.
Mr. Matheson votes no.
Mr. Dingle.
Mr. Dingle votes no.
Any other members wish to be recorded or change their vote? The clerk will report the vote. And while you're counting it, we will break to vote on the House floor, and then please come back after the last vote as promptly as possible, because we'd like to finish this bill today.
On that vote, Mr. Chairman, the nays were 30 and the ayes were 15, so it defeated.
15 ayes, 30 noes. The amendment's not agreed to. Committee will stand in recess until after the last vote. Meeting will come back to order. I don't want to preclude anybody from offering amendments, but let me ask if any of the people here have amendments they wish to offer. Gentleman from Michigan. Mr. Rogers. I don't want to encourage it, but I want... Turn on your mic.
Listed as ECR 1.
Without objection, the amendment will be considered as read, and the gentlelady from Wisconsin reserves a point of order.
I do indeed. Thank you.
Thank you, Mr. Chairman. The heart disease is the leading cause of death in the United States. About 700,000 people die each year from heart disease. Each year, heart disease costs over $140 billion, including health care services, medications, and lost productivity. Multiple new drugs designed to combat heart disease are currently being reviewed by the FDA. Yet this legislation would allow FDA funds to be diverted from heart disease drug reviews for tobacco regulation. I think this is a dangerous precedent to set and would further handcuff the FDA's ability to carry out its core mission, approving safe and effective medicines for Americans. My amendment would simply ensure that before the FDA undertakes the enormous task of tobacco regulation, current drug applications for heart disease receive a final determination. Millions of Americans rely on the FDA to bring these critical drugs to the market in order to save lives, reduce health care costs, and improve the quality of life for patients in heart disease. I would hope the majority would accept this common sense amendment to ensure the FDA can conduct its core mission. And with that, Mr. Chairman, I will yield back.
Mr. Chairman?
Yes, gentlelady from, where are you from? Wisconsin. Yes.
Yeah, not Arkansas.
Yeah, Arkansas. Ms. Ross.
I would withdraw my reservation, Mr. Chairman.
Reservations withdrawn. Further debate on the amendment. The chair recognizes himself to speak in opposition to it. I want FDA to deal with all applications dealing with heart disease drugs and cancer and all orphan drugs and other drugs as well. But that's not a reason to deny FDA the authority to deal with tobacco. And I would urge that this amendment be rejected. We ready for the question? All those in favor of the amendment say aye.
Aye.
Opposed, no. No. The noes have it, and the amendment's not agreed to. Do you really want a roll call vote? How about a division?
Is there a way to roll the roll call vote, Mr. Chairman, until you have your folks here?
Well, if the gentleman wants a roll call vote and wants to ask that we postpone the vote until other votes are taken, we can put that as a unanimous consent request, and I'll agree to it.
I would do that, Mr. Chairman.
Okay, and without objection, the roll call vote on this amendment will be postponed until a time when other amendments will be voted on by a call of the roll. Further amendments? Yes, Mr. Burgess.
Thank you, Mr. Chairman. I have an amendment at the desk.
Mr. Chairman, I reserve a point of order and thank the gentlelady from Wisconsin for filling in when I was gone.
Without objection, the gentleman's amendment will be considered as read. The chair notes a reservation of a point of order by the gentlelady from Colorado, and I now recognize the gentleman from Texas to explain his amendment.
Yes, thank you, Mr. Chairman. And just for a point of clarification, this is Burgess 031. With this bill, before the underlying bill, the base bill, we're going to give the FDA broad and almost limitless authority and discretion in their ability to regulate tobacco products for the protection of public health. Currently, there are some provisions in the bill that would limit the FDA's authority, and one that really concerns me the most is the one that would prohibit the FDA from requiring the manufacturer produce a cigarette that contains 0 milligrams of nicotine. My amendment proposes to strike subparagraph B in Section 907D3 of the Federal Food and Drug and Cosmetic Act as added by Section 101B3 of H.R. 1256, and then give the FDA the power to require the reduction of nicotine levels to zero in products. If the purpose of this bill is to reduce the harmful effects of this inherently dangerous product, then why not allow the FDA to scientifically analyze whether nicotine should be reduced and if that reduction should be in fact reduced to 0 milligrams of nicotine? It's illogical to handicap them, and that's why I'm introducing this amendment. I would note that we did our the recent reauthorization of the Consumer Protection Act last year. We required reduction of lead levels down to numbers that were actually unmeasurable by current technology. I don't think it's unrealistic to ask that nicotine, we at least give the FDA the authority to regulate nicotine down to a 0 milligram level. And I'll yield back the balance of my time.
Mr. Chairman, I withdraw my reservation.
The gentlelady from Colorado withdraws her reservation. Mr. Pallone.
Thank you, Mr. Chairman. I understand what Mr. Burgess is trying to accomplish, but I think it's not a good idea, essentially because if the FDA were to essentially ban nicotine or say that nicotine could not be part of cigarettes, it would be tantamount to an outright ban on cigarettes. And to me, it's almost like the prohibition situation. You know, we went through prohibition with alcohol. You ended up with a legal black market, if you will, with alcohol, and I think the same thing would happen with cigarettes. There would become a black market with cigarettes that obviously had nicotine, and we'd have to deal with that whole illicit cigarette manufacturing and chain of events. So I think that wisely what we're doing in the underlying bill is saying that that decision about an outright ban on nicotine is left to Congress, but we allow EPA to lower the levels of nicotine to a level that would be appropriate for the protection of the public health. I mean, I think it's a political decision more than anything else in this case, but I think it's a political decision that makes sense, and that's why I would oppose Mr. Burgess's amendment.
Will the gentleman yield?
Certainly.
And again, I know we went through this when we heard this bill the last time, but this is such an important point. We have said that we want the FDA as the premier federal agency regulating involved in regulation that has a basis in sound science. We want them to be at the forefront of this regulation. And then we have language in the bill that says because of the importance of a decision of the Secretary to issue a regulation requiring the reduction of nicotine yields of a tobacco product to 0, the Secretary is prohibited from taking such action under this Act. But what if their science leads them in the direction that lower nicotine levels are in fact beneficial for public health and that the lowest nicotine level really should be 0? The Secretary, their hands are tied and they cannot go to that level.
Well, if I could reclaim my time, I mean, this is essentially what I was saying. You know, you're a doctor, and I respect that you're looking at this from a scientific point of view, and I don't disagree that the science may very well say that no nicotine makes sense. But again, you know, this is a political decision. The FDA is not a political body. That's our job. And I think that the fear is that if you do that, or if the FDA decided to do that for scientific reasons, it would be tantamount to prohibition, and we know what happened. I mean, you know, I don't have to go through American history. It was an utter failure, and if anything, it encouraged people to drink more because it was, you know, because now it was illegal and they could buy it on the black market and encourage all kinds of organized crime and the whole thing. That's a political decision, in my opinion, and I think that we're making that here, and I think it's a wise one based on the fact that if you just outright do a prohibition, you'd get all those negative consequences.
Gentleman from New Jersey yields back the balance of its time. Further discussion, Mr. Barton?
I just want to ask some questions of the council. Under the bill, the base bill, could the FDA, without coming back to Congress, set a level that for all intents and purposes was equivalent to 0 nicotine?
sorry, sir, I'm not sure if I understand. With the amendment in or
No,
under
sir.
the
As the bill is currently configured, absent the Burgess Amendment, could the FDA set a standard for nicotine that, while it allowed some minute level, some de minimis level, 0.0001 something, have the effect of having a zero nicotine cigarette?
As I read the language, sir, it would prohibit the FDA from actually the Secretary from requiring it to be absolutely zero.
But they could come very, very close.
Yes,
they could,
sir.
for all intents and purposes, set a standard
Yes, sir.
that was a zero.
Well,
it wouldn't be zero.
It would not be zero as long as
point
it's a number greater than zero.
0.00001.
The language only, the language as it stands prohibits reducing to zero.
Okay.
It does not prohibit to any positive number above zero.
Okay. Now, I want to ask the author of the bill a question. I would assume that would be the chairman. What is the chairman's take if the FDA set a standard very, very, very close to zero, but which was not zero mathematically? Does the chairman think that is the same effect as a zero standard?
I don't know the answer to that. I think the FDA would have to not just look at how greatly the nicotine could be reduced, but what the consequences would be of reducing it to a low amount. Somebody earlier in the debate said people might start smoking more cigarettes to make up for the drop in nicotine. Well, I would hope the FDA would evaluate that before it made a decision. But we leave the determination to the FDA, and these questions we hope would be answered by review of the evidence and the science.
Okay. Well, the reason I asked the council the question, asked the chairman, who was the author of the bill, the question, the Burgess Amendment is the anti-hypocrisy amendment. Either the bill should give the FDA the authority to regulate nicotine, which it does, but not to eliminate it, and so put some level, minimal level, that people who choose to smoke get some nicotine value, benefit, whatever from it, or we ought to adopt the Burgess Amendment and say if they want to go to zero, they can go to zero. Because if you, apparently where we have the bill is, it's very hypocritical. They can go real close to zero, which so there's no real impact from the nicotine, but they can't go mathematically to zero. And I think that's you either go one way or the other. You either give them the authority to go all the way or set some minimal level beyond which they can't go. And we're not doing that. So
Gentleman, yield?
I'd be happy to yield.
Well, the bill leaves it to the FDA to do what's appropriate for the protection of the public health. And we leave them to do that, but I'm very hesitant to have them ban cigarettes or remove all nicotine and let them come back to Congress if they reach a determination that's appropriate to protect the public health beyond that. But I don't think it's hypocritical to let them have the decision and not let them go all the way to ban a cigarette.
Well, reclaiming my time, that's all what we have here is almost a dictionary definition of hypocrisy, because you achieve the consequence without taking the consequences politically of what it is that you achieve, which to me that is hypocrisy.
Will the gentleman yield?
Sure, be happy.
You know, I think that the chairman here in this legislation is recognizing the reality. I mean, some of this is science, and that's what the FDA is looking at. And some of this is, you know, us as legislators trying to figure out what works. And, you know, from my perspective, part of the success of getting people to reduce tobacco consumption is that it's starting to look bad. Like, you know, kids, if they think they can't smoke in a school or a public place and the people. Mr. Chairman, could I ask for an additional minute?
I would ask unanimous consent that I be given an additional minute so I can yield to my distinguished subcommittee chairman.
And you know, you don't want to get to the point where you just have an outright ban, because we know that historically, if you have an outright ban, you have this illicit market, and sometimes it almost becomes something positive because people know it's illegal, and so now they're going to do it. I mean, I think that those kinds of decisions are really left to the legislature, not to the scientists at the FDA, and I think that's, you know, what really is sort of underlying this decision. Now, it's not perfect as to, you know, where that spectrum meets the total ban, and it may very well be that we have to come back and look at it again if the FDA decides that they want to come close to zero. But there's got to be a recognition here that we as legislators have some role in this, not purely a scientific decision. And, you know, when you decide to just ban something outright, you've got to think about the impact practically. And I think we're in a better position, dare I say, to look at that sort of practical aspect of it and leave the scientific aspect to the FDA.
Well, reclaiming my 5 seconds, there is growing scientific evidence that it's not the nicotine itself that's a health hazard. Nicotine is addictive, but the health hazard is the particulate matter in the smoke and all of that that transmits the nicotine. So if you do a pure health hazard, apparently you can absorb a lot of nicotine without it itself being harmful to health. And I support the Burgess amendment.
Gentleman's time has expired. Are we ready for the question?
Mr.
Yes,
Chairman.
gentleman from Indiana.
Thank you, Mr. Chairman. I'm from Indiana, and I have the 8th largest tobacco growing district in the country, which most people don't know. And I was very much involved in drafting this language because the previous language was such that it would essentially allow the FDA to go to zero, in my view. I would rather see some kind of percentage in here, but this is the best I could get by with. The question I have, though, is for staff. Maybe they can answer this question. I've looked through most of this bill, but not all of it, and I'm at the part right now looking at it where it talks about requiring the reduction of nicotine yields of tobacco products to zero. The Secretary is prohibited from taking such actions like that. When they determine what that percentage is going to be, is there a time period that is established in this bill when that is to be actually put into practice?
To do so, as I understand it, would require regulation, and regulations under the Administrative Procedures Act under normal terms would have at least a 90-day notice period for regulation.
So if there's a 90-day notice and we know exactly when it's going to be, it could always come back to Congress because we're the regulating body over the FDA, that we could change that law, is my understanding. Is that correct, Mr. Chairman?
Yes, I believe you're correct.
So I guess the scenario could come to pass that the FDA would try to take it down to near zero, but there is some legislative oversight to prevent that from happening if it, in effect, takes tobacco off the market. And so therefore, I think that while it's not the best language that I would like to have, it at least is language that I can live with, and I think we do have a recourse if FDA goes too far. Thank you, Mr. Chairman. I'll yield back.
Thank you.
Mr. Chairman.
Further discussion. Gentleman from Oregon.
Thank you, Mr. Chairman. I yield to the gentleman from Texas for concluding comments.
And I thank the gentleman for yielding. Just on that last point, tobacco, cigarettes, as we all know them, are the delivery device for nicotine. There is no good reason to pull tobacco smoke into your lung unless it is to satisfy the addiction to nicotine. Removing nicotine from a cigarette as a delivery device would do more to eliminate the problem of smoking than almost any single effort that we can undertake. So if our true goal is to limit the public health exposure to cigarette smoke, we would eliminate the addictive component of cigarette smoke so we would not drive that behavior. Anyone who's watched someone train themselves to smoke, and you do have to do that, it's a very unpleasant process to go through initially because cigarette smoke is so noxious. But the reward is the nicotine that satisfies then the craving for the nicotine addiction after it occurs. And this, I think, is something that likely cigarette companies have understood for some time. My submission is that if we really want to get at the bottom of the public health issue, we will allow the FDA to allow a 0 milligram nicotine cigarette to be produced, and as a consequence, that cigarette would not satisfy the nicotine craving, and cigarette consumption would go down. Now, if our goal is to simply collect more taxes from the tobacco companies, then please, let's be honest about what we're doing and recognize that we're satisfying our addiction to tax dollars, not trying to impact public health. And I'll yield back the balance of my time.
Gentleman yields back the balance of his time. Are we ready for the question? The amendment before us is offered by the gentleman from Texas, Dr. Burgess. All those in favor of the amendment say aye. Aye. Opposed, no. No. The noes have it, and the amendment's not agreed to.
Could I ask that this be added to the list of votes that will be taken when the time is deemed as appropriate? I would like a roll call vote on this.
Okay. Well, the gentleman is requesting that he have a roll call vote and it be deferred to the time when we take other roll call votes, and without objection, that'll be the order. Further amendment. Mr. Deal.
I have an amendment at the desk. It's ECR 16.
Mr. Chairman, I reserve a point of order.
The amendment by the gentleman from Georgia, Mr. Deal, will be considered as read, and the chair will note that a point of order has been reserved by the gentlelady from Colorado. Mr. Deal is recognized to explain his amendment.
Thank you, Mr. Chairman. This is a little bit technical, so I hope you'll try to follow what I'm going to say. The last time this bill was before the committee, I raised the question of whether or not we created the possibility of allowing the Secretary to approve a product that was patented as the standard, and thereby, by approving a patented product as the standard, create a monopoly in the hands of the company that held the patent. Now, to the credit of the chairman, when I raised the issue, the bill that is before us today has attempted to address it, but I personally don't feel that it's addressed it as appropriately as we should. The change was, there was no reference in the original bill, as I recall, to this issue last time. The change says that when determining the effective date of a new product, the Secretary shall consider whether or not there is a patent that's in existence. Now, what that says to me is the Secretary establishes the standard, and then the question is, well, what effective date are we going to have for this standard to go into effect to be the standard for this new modified risk product? Well, and then it says he shall consider whether or not there's a patent in place on that standard. Let's say that that the standard is agreed to, and then he looks at it and says, well, it's a patented issue, and there are 10 more years left on the patent. I think common sense is going to tell us that the Secretary is not going to defer the approval of the standard for another 10 years. He's going to approve it, and when he approves it, he has then created a monopoly in the hands of the party that holds the patent. Now, that's the way I conceive the underlying bill's language. My amendment, and I've come off of where I was last time, I simply said last time that he could not approve a standard for a new modified risk product if that standard was a patented item. I have changed it not to make it a prohibition, but to simply say that he would consider, in establishing the standard, whether or not it is a patented product that meets that standard and therefore would create a monopoly by approving the standard. Under the underlying bill, he's already required to consider whether or not the new standard is technically achievable. I think it's only reasonable that he would also consider whether or not the standard is protected by a patent. And by adopting a standard that is a patented standard, he's therefore created a monopoly in the hands of whatever company holds that particular patent. I don't think that's where we want to go. That's not where I want to go. I think that it should be a standard that a multitude of products, perhaps, should be able to meet that same standard. But if we allow a patented product to become the standard, then we've created a monopoly. And we are the Commerce Committee, and I don't think the Commerce Committee ought to be in favor of creating monopolies. I appreciate your indulgence, and I would urge the adoption of the amendment. It is not an obligatory language. It just simply says, in the process of setting the standard, simply consider whether or not you have created a monopoly because it is already a patented product that you're basing the standard on. I would yield back my time.
Mr. Chairman, I withdraw my reservation.
The gentlelady from Colorado withdraws her reservations. Gentleman from Georgia yields back the balance of his time. Chair would recognize himself. I remember when we last considered this bill, there was the issue that you had raised, and I thought we had dealt with it by saying that Secretary would consider the technological achievability and availability of patents and setting effective dates for any new product standards. As I hear, and we did that, but as I hear you now, you want the Secretary to look at the issue of whether a patent pertains to the product before setting.
Would the Chairman yield?
Yes, certainly.
Yes, sir. You did make a change, and I think that's fine, but it only says that he shall consider when to set the effective date of the standard in light of whether or not there's a patent. In other words, he's already set the standard. If he sets the standard and the standard is a patented product that meets that standard and therefore is protected as the only product, he's then faced with the quandary of, well, I've established a standard, now I have to consider the patent life of the product that meets that standard, and I would have to delay the effective date of when the standard goes into place based on the patent. Now, he doesn't have to delay it, but if he doesn't delay it till the patent expires, then he, by virtue of that, has created a monopoly by approving that patented product as a standard. All I'm saying is, let's just require that he look at the issue of whether or not a patented product is the only one that meets the standard he's about to approve before he approves the standard, not put himself in the box of approving something that is patent protected and then having to say, well, so what? I'm going to let a monopoly exist for however much longer the patent life is. It's a matter of timing on it, Mr. Chairman.
I hear what you're saying, and I have an enormous regard for your knowledge of this area, but I'm worried that if we put this into the statute, that it's going to be an invitation for litigation every time there's a standard that's established. Let me request you that they withdraw this amendment and let me think it over and see if we could agree on something. I haven't thought it through, and I don't know that I disagree with you, but I feel uncomfortable accepting the amendment at this time.
If the Chairman will yield. Yeah. I will withdraw it, but I'm serious about the issue. I don't think we intend to create this, and I'm not trying to be obstructionist on this issue, but I do think we do not want to intentionally create a monopoly or maybe unintentionally create a monopoly. So I would ask unanimous consent to withdraw the amendment with that understanding.
I appreciate that, and I certainly agree with you. We don't want monopolies just blocking progress, and there ought to be limits on monopolies. We've discussed this issue in other contexts. So I thank you very much, and you have my word that we'll try to think it through together. Further amendments to the bill. Mr. Boyer.
Chairman. Thank you, Mr. Chairman. I have an amendment at the desk. It would be Boyer number 11.
Mr. Chairman, I reserve a point of order.
Without objection, the Boyer amendment number 11 will be considered as read. The chair will note that there's a reservation of a point of order by the gentlelady from Colorado, and Mr. Boyer is now recognized for 5 minutes to explain his amendment.
Thank you, Mr. Chairman. I offer this amendment to address my strong concerns that the FDA is not the agency to burden with tobacco regulation today for two main reasons. First, regulation of tobacco runs counter to the FDA's expertise in providing for the safety and efficacy of the nation's drugs and devices. Tobacco is an inherently dangerous product, and the FDA has no experience regulating such product. Frankly, it's counter to their culture. Secondly, the FDA continues to fail to perform its current duties, whether they are inspecting our nation's food manufacturing facilities or foreign drug manufacturing facilities. Matter of fact, I want to recognize our respected dear friend and colleague, Congressman John Dingell, for his efforts with his food and drug safety bill, and he has long championed the FDA in bringing their toes to the line. As Chairman Waxman, Congressman Dingell, Congressman Markey, Congressman Pallone, Congressman DeLauro stated, along with Senators Kennedy, Leahy, and Dodd in January of 2008, quote, "Today the FDA is an agency that is all but starved of resources. Experts from every affected sector agree that this desperate funding situation has rendered the FDA unable to protect the American public from even the most basic threats, including contaminated food, tainted and dangerous drugs, and faulty medical devices," end quote. So once again, I compliment John Dingell and his efforts with his food and drug safety bill, and I look forward to working with him in that endeavor. My question to my colleagues here today is, do you believe that the FDA is in a place to take on the multi-million-dollar tobacco industry? Over the past several years, this committee and others have held numerous hearings to determine what needs to be fixed at FDA so we can assure the American people that their food and their drugs and their medical devices are safe. As we talk about forcing the FDA to juggle a multi-billion-dollar tobacco industry, foreign drug manufacturing facilities are going mostly uninspected. The FDA's surveillance over the drugs on our market is inadequate. Hundreds of thousands of unregulated, potentially harmful drugs are streaming into our international mail facilities every day. As we consider this bill, we must not forget our discussions over the past years about the FDA's lack of resources, the inability to fulfill its missions. My amendment will move all tobacco regulation responsibilities out of the FDA, but will keep it under the jurisdiction of the Department of Health and Human Services and create the Tobacco Harm Reduction Center. This portion, which I'm offering here today, was in the substitute for which was earlier defeated. This movement reflects the understanding that tobacco regulation is a public health issue while ensuring the protection of the FDA's current mission. I ask for your support of my amendment and to create a dedicated federal agency devoted solely to tobacco regulation and not further the strain on the overburdened FDA. I note last year, the committee, we had a letter from the Secretary of Health and Human Services dated July 20th of 2008. It was addressed to Congressman Joe Barton from Michael Leavitt. In the letter itself, in the third paragraph, it says that in referencing the bill in which we're marking up here today, quote, "The bill will unfortunately undermine one of the nation's premier public health and regulatory institutions." That's a pretty strong statement from the from Michael Leavitt, who is then the Secretary of Health and Human Services. So, Chairman Waxman, you and I have had this discussion before. I know that you are firm in your beliefs with regard to the FDA. We had a discussion on how long do we think that it would take in order to stand up an agency. So whether it's the FDA that accepts this responsibility or it's another agency within Health and Human Services, it's going to take time, and I recognize that. But I think it would be better serve the country's interest if we had a separate agency within HHS, and for that I'm asking for consideration. I yield back.
Gentleman yields back his time. Mr. Pallone.
Thank you, Mr. Chairman. I oppose the amendment, and this is, from what I can see, taking part of your original substitute-like amendment out and just referencing the FDA part. And I sort of spoke on it before, but I want to say this. I mean, look, you can take various approaches to the FDA. There are some that just think the FDA should be abolished and we should get rid of it and replace it entirely. There are others like myself that think it is a very effective agency on many fronts because it has the kind of scientific expertise and the regulatory experience that would be effective in regulating tobacco products, and that the real problem is a lack of resources. I feel that I'm not looking to get rid of the FDA or not have them do the things that they're best at doing, and I think tobacco falls within this. They regulate foods, drugs, cosmetics, even pet food. Tobacco is certainly something that they're perfectly capable, and I think the best agency to deal with this. The difference here is that we do provide, with the user fee and the funding in this bill, the resources for them to do it, which I don't think is the case, unfortunately, in some of the other areas. We do need more appropriations. We need more money for them. Obviously, if you look at the bill that myself and Congressman Dingell and Stupak have sponsored that deals with food safety, among other things. That's a way of doing it, effectively doing the same thing for food safety. So I think the answer here is let's give them the resources, which we do under this legislation. Let's look at what they do on food and cosmetics and other things as we do in the other bill and give them the resources. Let's not just say that we need a new agency. And in any case, the issue of whether or not there should be a new agency, I think, should be looked at separately. It shouldn't be done under the auspices of this bill because we haven't had enough time to deal with it. It makes sense right now to put it under this bill and provide them with the resources, which is what this legislation does.
Mr. Chairman, I withdraw my reservation.
Gentleman withdraws her reservation. Gentleman from New Jersey yields back the balance of his time. The vote now comes on the Booyer amendment. All those in favor of the amendment will say aye. Aye. Opposed, no. No. The noes have it, and the amendment's not agreed to. Are there further amendments?
Chairman, may I have a recorded vote on that at an appropriate time?
Gentleman requests a recorded vote and that it be put off until the other recorded votes are taken.
Thank you.
Is that any objection to that request?
Reserving the right to object.
Gentleman from Texas, Mr. Barton.
Reserving the right to object, and I will not object, but I was not in the room when the deal was made to roll votes. I do oppose rolling votes in committee. I think members should be here. The longer we do that, the less member participation you're going to have. But since it was a unanimous consent request when I was out of the room, I'm not going to object today. But I just want the minority members to know that as a general principle, I oppose that. And after today's markup, we'll have a discussion with the chairman about it. But on this, I have no opposition to Mr. Booyer's recommendation.
Without objection, the unanimous consent request is agreed to, and the chair would also ask a unanimous consent that all rolled votes take place at the end of the markup when we're ready to proceed to prior to final passage. Without objection, that'll be the order. Are there other amendments? Mr. Gingrey.
Mr. Chairman, I have an amendment at the desk. I think it's amendment number 27.
Mr. Chairman, I reserve a point of order.
The Gingrey amendment will be considered as read. The chair notes a reservation of a point of order, and the gentleman from Georgia is recognized for 5 minutes.
Mr. Chairman, thank you. This amendment, quite simply, is a postponing amendment, postponing the effective date of this act and its amendments until the Secretary of Health and Human Services certifies that foreign facility drug inspection requirements are met. Mr. Chairman, the mission of the FDA is to promote and protect the public health. By piling onto the FDA's plate the regulation of tobacco and tobacco products, a role for which the FDA certainly is not yet prepared, this Congress will actually weaken the overall effectiveness of the FDA and compromise consumer protections that safeguard our families, our children, and our country. The FDA is a public health agency structured to regulate the development of products that are either intended for healing or for nourishment. Yet we have seen the FDA flounder with their charge to protect the health of consumers in this nation. Products that should be safe, as an example, infant formula or candy bars or indeed peanut butter, have proven deadly because of breakdowns in oversight. In light of these recent failures, I'm very concerned, Mr. Chairman, at the potential for further regulatory blunders that may endanger the lives of Americans. As public servants, it should be our duty to ensure that the FDA is able to fulfill its current charge before adding a new responsibility for a product wholly different than the other products that it regulates. In this country, a drug is not considered unapproved or adulterated if it comes from a plant that the FDA has never inspected. So my amendment before you today supports this important change, as I say, a postponing amendment. And let me give a couple of statistics, Mr. Chairman. The GAO estimated that FDA inspected only 8% of foreign drug establishments in 2007. Of the approximately 3,249 foreign drug establishments, FDA inspected only 332 of them. As our committee's hearings on the heparin death showed us, FDA must focus more attention and more resources on inspecting foreign drug establishment, and it spells out on page 143 of the bill that we are actually able to take money from the primary mission of FDA to take on this new charge. What does the chairman's bill do? It forces the FDA to use resources on building a new tobacco center instead of using the resources, as I say, to secure the safety of our nation's drugs. This amendment will stop the FDA from using resources to regulate tobacco until the Secretary of HHS certifies the FDA has inspected every foreign drug establishment within the previous 2 years. And with that, Mr. Chairman, I will encourage my colleagues on both sides of the aisle to support the amendment, and I yield back my time.
Mr. Chairman, I withdraw my reservation.
Mr. Pallone.
Well, I'm sort of repeating myself here. This bill, Mr. Waxman's bill, is self-funded. The resources are there to deal with the tobacco issue. I think that the gentleman, of course, is mixing the other issue with regard to food and drug inspection, which is addressed in the FDA Globalization Act that's sponsored by Mr. Dingell, Mr. Stupak, and myself. I would ask him, if he's concerned about that, sign on to our bill. We intend to move the bill fairly quickly. It again would fund the foreign drug facilities inspection that you're looking to that you're concerned about here, and I just don't think it makes sense to mix the two. We know the problems with the FDA. We know a lot of it has to do with resources. We're trying to address it on both fronts, but don't bring it up today and I know it's not your intention, but the practical consequence may be to scuttle this bill, and I think it's a mistake at this time, so I'd oppose the amendment.
But gentlemen,
I yield to the gentleman from Michigan.
I just think it's worth repeating all these ills that you bring up with the Waxman bill really could be resolved if you just join us in the global food and drug bill that we have pending before this Congress. Come join, co-sponsor it. We can resolve this. We've been working on this legislation for a couple of years. We finally have a president who's willing to put the resources into the FDA, but you can't continue to give resources to a agency that is really broken because of lack of leadership we've seen for the last few years. You mentioned heparin. Heparin, and we did that investigation. The problem there was the institutional review boards, which we're going to be having hearings on because there are serious breakdowns there. So there's a number of problems there. We're proposing legislation to address the ills that you bring up. We ask you to join us in co-sponsoring that legislation so we can move forward. But these excuses, and that's really what these amendments are, excuses to delay the Waxman legislation, are nothing more than excuses. And if we're serious about reforming the FDA to have them do their job, then join us. We'll do it. Let's move this legislation. And then let's together strengthen and improve our FDA. There are many good, dedicated employees in the FDA, but it's been rudderless for the last few years because of lack of leadership.
Gentleman yields back his time. Further discussion? If not, let's proceed to a vote. All those in favor of the Gingrey amendment say aye. Aye. Opposed, no. No. The amendment is no. The noes have it. The amendment is not agreed to. Next amendment. Mr. Boyer.
Thank you, Mr. Chairman. I have Boyer Amendment number 2. Now, this is an amendment I think we can agree on, Mr. Chairman.
Mr. Chairman, I reserve a point of order.
Oh, now.
Before we talk about agreeing to the amendment, let's have it presented. Clerk will report the amendment.
Amendment to H.R. 1256 offered by Mr. Boyer of Indiana.
Without objection, the amendment will be considered as read. The gentlelady from Colorado reserves a point of order, and the chair now recognizes the gentleman from Indiana for 5 minutes.
This is an amendment that I would refer to as the Fire-Safe Cigarette Amendment. Today, 22 states, plus the District of Columbia, have implemented fire-safe cigarette laws, and additional 15 states have passed fire-safe cigarette laws which have not yet become effective. The amendment I offer today highlights the effectiveness of the New York fire-safe cigarette standard and sets it as a ceiling for other state fire-safe cigarette regulations. New York was the first state to require that tobacco companies sell self-extinguishing cigarettes, and according to the Coalition of Fire-Safe Cigarettes, deaths caused by cigarette fires declined dramatically in New York State in the first few months that fire-safe cigarettes were mandated there in 2004. The use of cigarettes with proven reduced propensity to ignite other materials will save lives and offer the best opportunity to achieve significant improvements in fire protection. The New York State has taken the lead on this important issue and has set the effective standard for others to follow. So probably the best way to help, I'm going to hold this up. If members can take a look at this. This is a roll of tobacco paper. And what I've done here is I took a pencil and I darkened the areas where really there are lines that are set. If you could look at the paper, they're really where the paper is less porous. So what I did with a pencil, it was highlight the areas where it's less porous. So what happens is, hello? Look at this for a second, just for a second, please. Where it's the tobacco paper gets rolled like this, which means every certain point there's a less porous area of the paper of the cigarette. So when it begins to burn down, it begins to self-extinguish. It is a great standard, and I think it's one for which the states should be adopting, and I hope to set it as a ceiling, and that's the purpose of the amendment. So thank you very much.
Gentleman yield.
Yes, Mr. Chairman.
I'm trying to figure this out. Because I think what you say makes sense. The New York standard is a good standard. Many states have adopted it. If you made it as a floor, then it would require all states to abide by this standard. But you want to make it as a ceiling, and that just means states. See, states are moving on this, maybe slower than you'd like. Would you be willing to make it a floor? That they all states must at least have the New York standard.
Would the gentleman be willing to accept the amendment, and I'll continue to work with the gentleman?
No, on the basis that I'm suggesting.
Will the gentleman be willing to accept the amendment right now, and I'll be willing to work with the chairman?
Well, I'm willing to accept the amendment if you make that change.
Well, the New York standard is such a good standard, we shouldn't try to go beyond it. I'm trying to say,
Well, we may not.
be very delicate about the federal preemption. You brought that up to me, so I thought, well, all right, what's the best way I can draft this amendment in a manner whereby the New York standard is a standard that is utilized by the states?
Well, my view generally is if states are doing their job of adopting standards, we ought to leave them alone rather than preempt them. But your argument is that, well, a lot of states have adopted this standard, some states have not. So I could see the argument to say that we ought to at least have this standard. But if states are working on the problem, I wouldn't want to say they could never adopt a standard that's stronger. There may not be a standard that's stronger. But I don't want to preclude states from doing their job of protecting their own citizens. So my suggestion to you is let's make this the federal standard, but not preempt the states if they go stronger.
He's advocating the California tailpipe standard. That's what he's doing.
You want to create the federal standard, not a ceiling.
I want a floor rather than a ceiling. You want a ceiling. Do you want a ceiling, or did you want everybody
Well,
to
if you want the New York to be the federal standard, I'll go with you on the New York as a federal standard right now. Done deal.
Without a preemption.
No. Let's make that the federal standard. Make it the federal standard, and we'll continue to work together. Henry, come on. We've had enough good discussions among ourselves that we can work this out.
Well, let's withdraw it and work it out before we put it in the bill. 'Cause I'm not ready to preempt all the states.
Then, if I withdraw, do you want me to redraft the amendment in which this would be, we would use New York as the federal standard?
No, I want you to withdraw it, and then you and I work on something that we both can agree on.
We haven't agreed on much yet today.
You're making it hard.
Well, but you know, I still want to set a ceiling. You want to set it as a floor. We're pretty far apart.
Okay, well then I oppose the gentleman's amendment.
Well, now wait a second. No, I'm serious. We have we have an issue here, and I think somewhere we can find a common ground on this. I'm really surprised.
Well, if we can find a common ground,
Henry, I thought this is the one you said, Steve, thank you. We can agree on this one. Let's keep on moving.
Well, I hope I'm not going back on some comment I made to you, but I don't recall that.
No.
I don't want to preempt the states. I see what you're trying to do. If we didn't have this amendment at all, the states are moving along quite fine. They're moving to the New York standard. They may even do better than the New York standard. But what you're trying to accomplish is a worthwhile goal, and I support your goal, but I don't believe in Washington having all the answers to all the problems. I think states ought to be able to adopt laws that protect their own people.
Wait a second.
Well, the states can't adopt an FDA.
Mr. Chairman, this is a pretty important discussion, because when we end up doing Mr. Dingell's food and drug safety bill, there'll be an issue that will come before the committee regarding electronic pedigree. And the standard for which I am working with now is the California standard. So are you about to say, Steve, with regard to electronic pedigree, if I'm not going to use New York as a standard, then I guess we're not going to use California standard in electronic pedigree.
You want to discuss it now, or do you want to pull it back and then let's see if we can work something out? Or if you want to stay with your amendment,
if the
let's
gentleman,
stay with your amendment.
All right.
What do you want to do?
Well, I want to work with you on this, because I think it's something that you and I ought to be able to work through. I'll withdraw the amendment in exchange for the pledge for the chairman and you and I to figure this one out.
I accept your withdrawing of the amendment, and I will make every effort to work it out.
All right, I accept that. Thank you.
Thank you.
I withdraw the amendment. You ask unanimous consent to withdraw the amendment.
Unanimous consent not required. The gentleman withdraws his amendment. Are there further amendments? Mr. Rogers.
Thank you, Mr. Chairman. I would move to en bloc Rogers Amendments 2, 3, 4, 5, and 7.
Mr. Chairman, I reserve a point of order.
The gentleman, first of all, ask unanimous consent that those amendments be considered in block, and without objection, that'll be the order. And I'll ask unanimous consent that all those amendments be considered as read, and without objection, that'll be the order. And the gentlelady from Colorado reserves a point of order on the en bloc amendment. And the gentleman from Michigan is recognized for 5 minutes.
Thank you, Mr. Chairman, and just in the effort to speed this up, but at least to make at least the plea that we would do everything we possibly can not to take away from the FDA's core mission in slowing down for 1 minute, 1 day, or $1 their effort to get a new medicine or a virus through final determination if it will in fact better someone's life. And the amendments of which I have en bloc are and I'll just give you some examples, the HPV virus. There's some vaccines that they think they can help maybe as up to late 40s for women on HPV, which we know is one of the leading indicators that causes cervical cancer in women. Why we would jeopardize that determination now, of all times, when somebody may be that close to getting a cure is beyond me. I mean, it just doesn't make sense. That's why I think these amendments, if we work together, we can probably come to some sense of agreement. On pediatric cancer, childhood cancers are the #1 disease killer for children. Pediatric cancers are the #1 disease killer for children. And what this bill does is it may take away that $1, that 1 minute. And I know I've experienced this in my office where parents call up in just the most heart-wrenching pleas you can possibly imagine about, listen, this thing is in trial. Can you get me, we will take it out of the course of its determination. Please, this is our last effort to cure my son, my daughter, my wife. Will you please do it? And of course, the rules are pretty tight, and we can't do it. So what we're proposing is maybe we slow it down. It's not right for us to do that. It is just not right to do that. And we have the opportunity here to say, listen, these things are important. Pediatric cancer is important. HPV virus, if you're infected and you're 42 years old, is important. Breast cancer, colorectal cancer, arthritis. All of the amendments deal with these issues and say, let us not take $1, 1 minute, 1 ounce of time from one scientist who is making these determinations that may in fact save somebody's life. That's what we're saying. We know right now today that cigarettes are dangerous. That's why we're having this markup, and I thank you for it. And I voted for the bill last time in hopes we could work through some of these issues. And if we can get to that determination that we're not going to take away from any other disease, then I can be there. But right now I have real concerns, Mr. Chairman, and I would hope that we would consider this amendment in the spirit of which was intended, and we can get some bipartisan support of saying, let the scientists make cures. Put every dollar toward those cures of those people who are sick today. And we'll get to the cancer stuff. We're going to get there. We are. But let's make sure that nobody with cervical cancer doesn't have the opportunity, or at least preventative, with HPV vaccination, or somebody whose child has pediatric cancer doesn't have every effort spent every day with every resource making sure that the next round of disease, medicine, vaccines, whatever it is around to save that child's life. That's all we're saying. I hope we can work this out. I would urge the strong support of this amendment.
Chairman, I withdraw my reservation.
The reservation's withdrawn. Mr. Pallone?
Well, Mr. Chairman, I have to oppose the amendment. I mean, we've said many times this afternoon that your underlying bill will not divert resources away from any other important programs at FDA, like food safety or drug safety. It's fully funded by industry-paid user fees. None of the funding for the new Center for Tobacco will be taken away from existing FDA resources. Look, if we regulate tobacco in an effective way, it is preventative, and it may very well be that many cancers will be prevented. So I'm not trying to take away from what you're trying to achieve by saying all these other things that are both preventative vaccinations in other areas or drugs that will cure diseases that people already have are not important. But there's no reason to believe that what we're doing today would in any way inhibit those other applications from being approved, and in fact just the opposite. It may very well be, in fact I would say it's almost guaranteed, that by having this regulation of tobacco that's proposed by Mr. Waxman's bill will prevent a lot of cancers, maybe even some of the ones that you mentioned. I yield back.
Gentleman yields back his time. Are there further discussion? If not, we'll proceed to a vote on the en bloc Rogers Amendment. All those in favor say aye. Aye. Opposed, no. No. The noes have it, and the amendment's not agreed to. We have a number of pending roll call votes, and that will take time. The rules require that 1/6 of the members present request a roll call vote along with you. Do members wish to have another roll call vote? Those who wish a roll call vote will raise your hand. A sufficient number. And without objection, if the gentleman would permit, this will be added to the list of others whereby we're going to have a roll call vote.
And if I may comment, Mr. Chairman,
yes.
Just 1 second. And one of the reasons I think you're seeing that we are trying to work with the bill and we hope make it better. We really haven't had the opportunity, and this has been a pretty rough start for trying to work together. And I know you've got your marching orders, and you've got to do what you got to do, and you got your folks who aren't really participatory in amendments. But this is our only opportunity to do that. And the longer we don't get an opportunity to work for it, this is the only option that we have to allow other Americans have the right to petition their government. And we feel that's very, very important. So we don't mean to be dilatory. We're not trying to be a pain in your rear. But we do believe that everybody's voice, we may be accomplishing that, but we think and we believe that everybody's voice needs to have an opportunity to be heard in these bills. And thus far, we've seen, candidly, Mr. Chairman, just a really poor example of how you can work together on issues where we know we have common ground. And I don't even blame you. I think it's coming. I think that there's directions and orders that are laid down around this Congress that I think are probably detrimental.
I think the gentleman makes an excellent point. I was only questioning whether we wanted another roll call vote, but I do want to follow the regular order here. This was a bill that was considered in the last Congress and voted on by more than 2/3 of the House, and we're following the regular order. And under the regular order, the chair would request any further amendments. Mr. Boyer.
Mr. Chairman, I have Boyer Amendment number 1. I refer to it as the Export Amendment.
Chairman, reserving a point of order.
Gentleman from Indiana offers an amendment which he characterized as the export amendment. And without objection, that amendment will be considered as read. Gentleman from Colorado is reserved a point of order. And the gentleman from Indiana is recognized to speak on behalf of his amendment.
Thank you. Mr. Chairman, I refer this to as the export amendment, but it's a clarifying amendment. So as we went through the academics of your bill here over the last several months, this one is a new amendment, was not considered last year. The bill includes a significant inconsistency, I believe, with regard to the treatment of tobacco exports, and I offer an amendment to clear up that inconsistency. The purpose of this amendment is to clarify that raw leaf produced in this country or product manufactured in this country for distribution abroad can be exported to the standards specified by the country of distribution. For example, the European Union requires all cigarettes for sale in the EU countries to conform to the 10-1-10 product standard, which means 10 milligrams of tar, 1 milligram of nicotine, 10 milligrams of carbon monoxide. The EU also conforms to the Cooperation Center for Scientific Research relative to tobacco pesticide standards for tobacco leaf production. However, under this bill, U.S. farmers and businesses are essentially forbidden from producing leaf or products that could be legally sold in the European Union or elsewhere. We must ensure that products manufactured strictly for export do not have to comply with the tobacco standards expressly written for tobacco products sold within the United States. Manufacturers must be able to design their export products to the specifications of the countries to which they are exporting. We place great demands upon importers to produce products with regard to our country's standards, and in turn we must give foreign nations jurisdiction over tobacco products for which they import from the United States. That is essentially the purpose of the clarifying amendment. I yield to the gentleman.
As I understand the basic bill, Section 103(1) exempts products manufactured, maybe this is the current law, exempts products manufactured for export from the product standards and labeling and warning provisions. And this would apply for standards for tobacco products for export, that it applies to food and drugs, and already exempts those products made for export that meet the importing country's standards. So I don't see what the purpose is of your amendment, but what I fear could happen with this is that language is so broadly written it would also exempt manufacturers of products made for export from being required to provide FDA with the basic information FDA would need to determine the nature and extent of products being made in the U.S. that do not meet U.S. standards. And it would make it harder for U.S. authorities to track whether and how much of these non-conforming products intended for export are secretly and illegally being diverted back into the U.S. market. So I don't understand the purpose of the amendment. If it's for export, they don't have to.
Wait a second. What we're trying to do here is we want to be in the import-export business. So to my colleague of Indiana, it's got so much tobacco, you want to be able to get that tobacco into the European Union and do so in a manner that establishes or sets to their specifications or requirements. So if it's a product that's not going to be sold here in the United States, it's a product that should meet that country of origin standards.
That's
so
right.
I recognize that what you have here in the bill, I just want to make sure that in your bill that no other provisions or articles within your bill have an impact with regard to a tobacco grower in Mr. Hill's district gets punished. That's the purpose.
What the gentleman would further yield.
Yes.
The Section 103(1) of the bill says a product is manufactured for export it exempts the product if it's manufactured for export. Your amendment says that the Secretary shall see whether it's complying with the laws and regulations of the country of destination instead of the laws and regulations otherwise applicable, which would mean U.S. laws. So it seems to me we've covered it already. And I worry about repeating it in your way for fear that it might have other consequences. But it seems to me we accomplished what you say you want to accomplish.
Well, maybe this is a moment where you want to take a tougher approach than I do. I guess I'm saying if you're going to create it under your bill, if it's going to be FDA, then the FDA's got the jurisdiction and they can put their nose into whether or not that product complies or not. If you're going to, who's going to make that determination with regard to it's exempt or not? Who makes that determination under your bill?
Well, if the law says a product's exempt from FDA approval or jurisdiction, if it's meant for export, then that's the law. And that's what I understand our bill to say. But you go add on another part, which I'm not sure is required under the law, and that's that the Secretary is going to decide whether the laws of the country of destination are complied with. And I don't know, do we let them decide? We wouldn't want... it just seems hard for us to have to see whether something complies with another country's laws and regulations.
All right,
it's just exempt.
I'll tell you what I'll do. This is another one. This goes back to I wish you and I would have had this meeting last week. So I'll withdraw this amendment and let's add it to the fire safe cigarette ones and we'll work through this one. Okay.
All right.
So I withdraw the amendment.
Okay. Thank you. Are there further amendments? Mr. Rogers.
Thank you, Mr. Chairman. Here's my last ditch at what I think is the most important issue here. And it's something that...
You have an amendment?
I do have an amendment. I'm sorry. I have an amendment to the desk. It's 008.
Chairman, I reserve a point of order.
Gentleman's Amendment 008 will be considered as read. The gentlelady from Colorado has reserved a point of order. And gentleman is recognized to explain this amendment.
And thank you, Mr. Chairman. If we're serious, and I know that Chairman Pallone and yourself and others have used the argument, listen, there's no money that comes out of this bill. That's great, except on page 142, it says, in fact, that money is coming out of the general fund for this. And my argument is, if you believe that's true and that's why you support the bill, then this is an easy amendment. I just strike that language. And it basically makes very clear that only user fee money can be used. And let's be very, very clear on it. Let's be absolutely certain that there is no opportunity for FDA general fund money to go over to get this thing kicked off. And again, the reason I think that is so important is this, as I'm the co-chair of the Cancer Working Group, as is Ms. Eshu, and I tell you that sometimes those matter of days for approval do make a difference in people's lives.
Who asked you?
They do. And so I hesitate to move into this because without or with the understanding that they can take money out of the general fund. They will have to allocate that away from something else. And if that's your son, daughter, mother, brother, you don't want that to happen. You absolutely don't want that to happen. And I don't think from what you're saying, Mr. Chairman, you don't want it to happen either, because you've always argued that that doesn't happen in this bill. So let's very clearly make the for sure and for certain statement here that no money comes out of the general fund. That's what my amendment is. Very, very simple. It is a prohibition against the use of other funds, and only fees collected under this section are the only funds authorized to be made available for the purposes prescribed. It strikes the section that allows general fund money and says very clearly it can only be user fees. And I would hope that this is something that we could agree on in a bipartisan way. It's what you all have all talked about. I think it's what your intentions are. Let's make very, very clear that this is exactly what this bill will do when it comes to the most important thing, as we all know, is funding for the FDA. When you're talking about food inspections, you're talking about certification and termination of the next generation of medicine and vaccines and et cetera. And with that, Mr. Chairman, in a bipartisan effort here, I would yield back.
Gentleman yields back his time. The chair recognizes himself. In the bill, while the user fees are being collected, for the first 2 quarters, the general fund dollars can be used to carry on the purposes of regulating tobacco at the FDA. It's only for that short period of time. And then when the user fees are collected, the money that's used must be returned. What the gentleman would seek to do is to say, even in those first 2 quarters, if there's not enough money yet collected from user fees, FDA can only use the money that it has collected from user fees. I don't understand why we'd want to restrict FDA from getting started with the job as long as FDA resources are not going to be directed to tobacco and not for other purposes, except for that very short period of time, and they'll get that money back. So I would urge the gentleman to reconsider his amendment. It's only for those first 2 quarters while they're collecting the user fees.
Mr. Chairman, I withdraw my reservation.
Gentleman, Mr.
Well,
Wall.
I seek recognition, Mr. Chairman, if you're...
Gentleman's recognized.
In support of the gentleman's amendment, having been involved in the oversight hearings in FDA and food safety and all, and having watched in a bipartisan manner the problems at FDA and the need for every penny that's there for inspection for food safety and all, and we haven't acted on any other legislation to date, although I assume we will. It would seem prudent that before we give FDA a new challenge and then say, go start this new program and you can draw on your existing funds to do it, and then you have to reimburse once the fees are collected. But in the language in your bill, I don't believe there's a date certain for reimbursement, is there, Mr. Chairman? It just says they have to be reimbursed.
We could add a date certain if you wanted it, but it's only the startup period.
I understand that.
Yes.
But so anyway, you don't have a date certain, and that would be preferable, but I think it still doesn't get at the underlying issue several of us have problems with, and I voted for this bill last time. In fact, I co-sponsored it, and I want it to pass. But I think this is a real live issue that some of us have concern about, given the problems FDA has, and continues to have. And so I intend to support the gentleman's amendment. I'd prefer us to not give the FDA something new until they have the money to actually pay for what we're giving them to do, not allow them instead to go dip into other funds and pay for it. With that, I would yield to the gentleman.
Oh, yes, go ahead. Yield to him.
Did you want me to yield to you?
Well, if you would yield to me as well, very briefly, I think we have a disagreement because I don't want to delay the FDA activities for months while we're collecting the user fee, and if they can get started, I think we shouldn't delay them. So I just respectfully disagree.
And with that,
you're yielding to Mr. Rogers.
I would like to, Mr. Chairman. I would yield to my colleague from Michigan.
Several problems, and we're not talking about a matter of days or weeks. We're talking about a matter of months in this particular case. And if you read the language, Mr. Chairman, this is what concerns me. It sets out the 2 fiscal quarters or the 6 months, but there's no prescription in here that it just says it has to be paid back. Okay. Now you've got money commingling a fund within a department. These departments loan each other money all the time, and a lot of times it gets written off on accounting, as we all know. They don't have to necessarily pay it back. If it happens at the end of a fiscal year, they have to reimburse, if they do, from this year's budget, which is not likely actually to happen. So you will have a hole for an undetermined amount of time, and they can go do this through 6 months worth of time. In 6 months, when somebody is waiting for that determination, if you're in the final stages of trial and determination, clinical trial, human trials, you're in that final determination, 6 months is a life sentence. It's a life sentence to people. And my argument is, can't we do better? And I understand, I mean, before it was there was no use of direct funds in here. Well, now you're saying, well, we're just kidding. There are some use of funds, but they may have to pay it back at some time in the future. That concerns me, because for the same FDA that my colleague from Michigan, who so rightly says has got issues, I'm not sure I trust them to know that that money isn't going to get back on those benches with those doctors making those determinations. We have no way of knowing that. There's nothing in here that says they have to do that. It just says that should be reimbursed at some point. Well, if I'm the director and things are happening, I don't know. It doesn't say I have to. It just says I should. It worries me a lot. And that 6 month time that you've given them, 6 months, as I said before, can be a life sentence. I've seen it happen. I had the most horrible case from a woman who wanted to get a drug. She had lung cancer. And I can't tell you how many times conversations I had, not only with her but her husband, and the most heart-wrenching thing you can possibly go through, calling the company saying, please, can't you release this thing? We know you're only a matter of weeks out. Can't you? This might actually save their lives, but the rules prohibit it. It was pretty clear. And as she passed away, it may have not. We will never know. But when how would you like to have to pick up the phone and say, oh, by the way, it was maybe 3 weeks, now it's 6 months? It's not right for us to do that. There is so much effort and energy put into making sure that the next generation of life-saving medicines are available. Why would we make this mistake in this bill? And believe me, Mr. Chairman, I voted for this bill the last time. I want to vote for this bill. This worries me more than you can possibly imagine, because time does cost lives when you're talking about the development of the next generation of medicines, and I'd yield back the time.
Any further discussion on the amendment? If not, we'll proceed to a vote. All those in favor of the amendment say aye.
Aye.
Opposed, no. No. It appears the noes have it. Gentlemen request a roll call vote. We'll add this to the list. Are there further amendments?
Mr. Chairman.
Who seeks recognition?
Mr. Boyer of Indiana.
Boyer of Indiana. For what purpose does the gentleman seek recognition?
To offer another amendment.
Chairman.
May the chair inquire how many amendments the gentleman will be offering to this bill?
3, maybe 4.
3, maybe 4. And
I thought about whether I could put them together, but I don't think I can.
You don't think you can put them together?
I thought about it.
Gentleman will identify his amendment.
The Boyer Amendment number 5.
Boyer Amendment number 5, without objections, considered as read. Gentlelady from Colorado reserves a point of order. The gentleman from Indiana is recognized to speak on his amendment.
Thank you, Mr. Chairman. I would title this amendment the Illicit Tobacco Trade Amendment. According to a report released last year by the House Homeland Security Committee entitled Tobacco and Terror, How Cigarette Smuggling is Funding Our Enemies Abroad. Law enforcement officials estimate that in New York State alone, quote, smuggling networks generate between $200,000 and $300,000 per week. A large percentage of the money is believed to be sent back to the Middle East, where it is directly and indirectly used to finance groups such as Hezbollah, Hamas, and Al-Qaeda, end quote. The findings of the bill before us state that, quote, tobacco products have been used to facilitate and finance criminal activities both domestically and internationally. Illicit trade of tobacco products has been linked to organized crime and terrorist groups, end quote. Further, one of the purposes of the bill expressly states that the bill is intended to, quote, strengthen legislation against illicit trade in tobacco products, end quote. However, there is nothing to ensure that this bill will not exacerbate the widespread problem of illicit tobacco trade in our country. My amendment hopes to make sure that before promulgating specific tobacco product standards, the Secretary must determine that such standards will not contribute to a significant increase in the demand for contraband tobacco products, and the standard will not contribute to the expansion of illicit trade of tobacco products by organized crime and terror groups. As the World Health Organization has reported, the illicit trade of tobacco products contributes to the global rise in tobacco consumption and making cigarettes cheaper and more accessible. Such products are essentially attractive to people who are price sensitive and least able to afford health care, such as the young and the poor. Illicit tobacco allows cigarettes to be sold as singles instead of packs in unregulated outlets that make it more accessible to youth. The World Health Organization reported that tobacco smuggling undermines legal restrictions and health regulations of tobacco. I believe we must ensure that we do not create a regulatory scheme that increases illicit tobacco trade and creates an underground system by which the most harmful tobacco products are widespread and easily attainable in our country. So I recognize, Mr. Chairman, that you asked for a study. However, I think we need to make sure that any FDA standards, before they go into effect, do not increase illicit trade, and that is the purpose of this amendment. I yield to the Chairman.
You yield to me?
Yes.
Thank you. I didn't ask for a study in our legislation. The proposal, the bill before us, requires FDA to consider the impact of a proposed tobacco product standards on increasing the demand for contraband or non-compliant tobacco products before making it final. I think that accomplishes the job that we need done. The reason I would oppose spelling it out as you have is that the more you spell out in statute, the more it becomes a basis for a lawsuit by somebody who doesn't want the FDA to act. They'll say, you didn't really do this enough. You didn't follow this step and jump through this hoop and dot this I and cross that T. So we ask them to, and we require them to consider the impact, but we don't say that you cannot go forward with a regulation unless you have done all of these other things that's spelled out in your amendment. So I respectfully have to disagree with you and oppose your amendment.
Well, Mr. Chairman,
I reclaim my time, and I accept the admonishment. You're right, you didn't use the word study, but to consider, obviously they have to put their academic brain power together here, and I just go ahead and require it. And you're right, that's a completely two different approaches to this. And I'm trying to figure out how you and I can get on the same page at some point in time. We're going to do this, Mr. Chairman. I'll yield to Mr. Pallone.
I don't really want to take up time, so I'm just, the thing that worries me about this one, Mr. Boyer, is that, I mean, it would be so easy for the tobacco industry or somebody who wanted to stop, you know, tobacco standards from going forward to simply, you know, manipulate things so that this illicit trade or trafficking actually began, and then use that as a reason to say that, you know, we should move forward with a standard. I mean, how do you ever get to the point where you can actually certify that a standard is going to have no impact on contraband trafficking or illicit trade? I just don't see how. So I understand, you know, I know that you're well-meaning. I'm not suggesting otherwise, but I would be very concerned that if you put this into place, it would be very easy for someone to say that we never met that, you know, that threshold, or even somehow, you know, try to make it so that the illicit traffic and the threat is there, and say, oh, therefore we can't have a standard.
Well, I reclaim my time, and I know it's expired. I'll take care of this, Mr. Chairman. Mr. Pallone, I never considered what you just said. What I did is I looked at what the Committee of Jurisdiction had stated, along with the World Health Organization, along with what the Chairman's intent was, and I just thought it would be prudent to just go ahead and require it. So if the Chairman disagrees, I'll withdraw the amendment, and we'll continue to have our discussions as we do on the others. Okay?
Without objection, well, you don't need unanimous consent. The gentleman withdraws his amendment.
Yes, I withdraw the amendment. I also have,
and adds to the agenda for our discussions, which I look forward to.
Thank you. I also have another amendment.
Well, let me ask, do any other members have amendments? If not, then Mr. Boyer is the last one with amendments.
I have amendment number 7.
Mr. Chairman, reserve a point of order.
Amendment number 7 by Mr. Boyer will be considered as read. The gentlelady from Colorado reserves a point of order. The gentleman is recognized to explain it.
This amendment would refer to the your Tobacco Products Advisory Committee. My amendment maintains the member groups represented in the bill's Tobacco Product Advisory Committee, but adds one expert in tobacco harm reduction and one expert in the illicit trade of tobacco products. These are two very important groups that we really have dominated part of our discussions here today, and I think they're overlooked on the Advisory Council, which will make recommendations to the new tobacco regulatory agency created under the bill. So if we're serious about addressing the problems of death and disease attributed to tobacco use, I think we need experts on the committee who have studied the tobacco harm reduction and on how we move smokers away from combustible products toward less harmful non-smoking products if they can occur or will not, or individuals cannot or will not discontinue their tobacco use. Additionally, any actions taken by the new tobacco regulatory agency should be scrutinized from the viewpoint of an expert on illicit trade of tobacco products, the discussion for which we had just had. I believe these two members will provide an important and beneficial instruction to the Tobacco Product Advisory Committee, and I urge the adoption of the amendment.
Mr. Chairman, I withdraw my reservation.
Will the gentleman yield to me? Well, the gentleman yields back the balance of his time. Chair recognizes himself. This amendment changes the makeup of an advisory committee, which is to advise on science and health issues, by taking two of the professionals in this area and replacing them with other people, including representatives from the tobacco industry. We have a disagreement about this, and I'm going to oppose the amendment. Mr. Boyer, do you want to talk again? I'll yield you time.
Thank you. Thank you. Here's what I'm going to do. I've got two other amendments. I'm not going to offer them. Okay? I'm not going to offer them. I think what we should do, Mr. Chairman, is since we've got other issues for which we have agreed that we're going to discuss, I'm going to take the other issues on pesticides and harm reduction along with this amendment, and you and I get to have a sit down and see what we can come to a meeting of the minds, if we can. You and I have worked on other issues together, and when you came to me and had a tough issue, I was there for you. And so I think that the two of us ought to be able to figure out how we can come together on some of these issues. So I'll withdraw this amendment. I will not offer my other two amendments. And before we get to the floor, you and I will work through these. Is that fair?
It's fair enough, and I accept your good faith offer to sit down and talk it through with me, and I'll look forward to that opportunity. Are there any other amendments? If not, we will proceed to a roll call vote on the pending amendments, after which, without objection, after completion of the roll call votes on the pending amendments, the previous question will be automatically ordered, and we'll then go to final passage. So I want to advise all members who are sitting, watching this whole proceeding on their television sets in their offices, to because what else would they be doing, to take note that we're about to proceed to a roll call vote. Will the clerk tell us how many amendments we're going to have a roll call vote on?
Mr. Chairman, there were 5 amendments that were postponed for roll call,
okay,
including the en bloc one.
Okay. The first one, in order, clerk will tell us which one is first in order.
Mr. Chairman, that was the amendment offered by Mr. Rogers, 001.
Mr. Chairman.
Limitation of application.
Mr. Chairman.
Yes, Mr. Martin.
Strike the requisite number of words.
Gentleman's recognized.
I'd like to point out we've never done this before.
Yes.
And we have lots of people who are not here.
Yeah.
So I would recommend that the chairman have a quorum call to get members here and then do the roll call votes.
Why don't we do the roll call vote, and we're not going to declare the vote over unless the quorum has responded.
Okay. Because, I mean, it's not...
Save the time.
Mr. Chairman?
Yes,
It's not fair to have roll call votes when less than half the...
Well, do you want a quorum call?
I'm just suggesting.
I'm just trying to figure out the quickest way to do it. But if you want a quorum call, we can do that, or we can call the roll, and then members will come and.
You're the chairman.
We'll wait. Mr. Boyd, do you have a suggestion?
Before you ask for the vote, if I may, Mr.
Yes.
Chairman, I ask that a letter to you from the Association of National Advertisers, the American Association of Advertising Agencies, and the American Advertising Federation be included in the record. This letter highlights the concerns the 3 agencies have on the constitutionality of some of the provisions in the bill. I shared this with you, and I would ask unanimous consent that this letter dated March 3rd, 2009 be entered into the record.
Without objection, is it one letter?
It is
several letters.
No, it's one letter, but
without objection, the letter referred to by Mr. Boyer will be made part of the record. Let's proceed on a roll call vote. And the roll will not be closed until at least a quorum, and we'll give everybody a full opportunity to respond. So the clerk will call the roll.
Mr. Waxman? No. Mr. Waxman, no. Mr. Dingell?
What are we voting on? Which amendment?
The clerk will tell us again the vote.
Mr. Chairman,
this is Mr. Rogers, one of Mr. Rogers' amendment, not the unblocked one.
Right. It's the Rogers Amendment number 001 regarding limitation on application of act. Is that right?
Please proceed with the vote. Roll. Vote. Yeah.
Mr. Dingell. Mr. Markey. Mr. Boucher. Mr. Pallone.
No.
Mr. Pallone, no. Mr. Gordon. Mr. Rush. Ms. Eshoo. Mr. Stupak. Mr. Engel. Mr. Green. Ms. DeGette. Ms. DeGette votes no. Mrs. Capps. Mr. Doyle.
We have 5 amendments.
Ms. Harmon. Ms. Harmon votes no. Ms. Schakowsky. Ms. Schakowsky votes no. Mr. Gonzalez. Mr. Inslee. Mr. Inslee votes no. Ms. Baldwin. Ms. Baldwin votes no. Mr. Ross. Mr. Weiner. Mr. Weiner votes no. Mr. Matheson. Mr. Butterfield. Mr. Melanson. Mr. Melanson votes no. Mr. Barrow. Mr. Barrow votes no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. No. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton votes no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Barton. Aye. Mr. Barton, aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Stearns. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Shattuck. Mr. Blunt. Mr. Boyer. Mr. Boyer votes aye. Mr. Radonovich. Mr. Pitts. Mr. Pitts votes aye. Ms. Bono-Mack. Ms. Bono-Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Murphy of Pennsylvania. Mr. Burgess. Ms. Blackburn. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Skellies. Mr. Skellies, aye.
Why don't you call the roll of those members who did not respond?
All right.
Or do you want to just recognize them?
I know. Mr. Boucher.
Okay.
Votes no.
Mr. Boucher, no. Mr. Green. No. Mr. Green votes no. Mrs. Capps. Mrs. Capps, no. Mr. Butterfield. No. Mr. Butterfield, no. Mr. Engel. No. Mr. Engel votes no. Mr. Gordon. No. Mr. Gordon, no. Mr. Stupak. No. Mr. Stupak votes no. Mr. Radonovich. Mr. Radonovich votes aye. Mr. Matheson. Mr. Matheson votes no.
Mr. Ross?
Mr. Ross. Mr. Ross votes no.
Have all members responded to the vote? Any member wish to change his or her vote? If not, the clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 13 and the nays were 28.
13 ayes, 28 noes. The amendment is not agreed to. We now proceed to the second of what will be 6 roll call votes. Clerk will report the amendment that we're voting on, and then we'll proceed to the vote.
Mr. Chairman, this was an amendment to H.R. 1256 offered by Mr. Burgess in Section 907D3 of the Federal Food, Drug, and Cosmetic Act, as added by Section 101B3 of the
We all
bill,
know that.
strike subparagraph B.
Okay. Clerk will call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Dingle votes no. Mr. Markey? Mr. Boucher? Mr. Boucher, no. Mr. Pallone? Hold on one second. Mr. Pallone, no. Mr. Gordon? Mr. Gordon votes no. Mr. Rush? Ms. Eshoo? Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mrs. Capps votes no. Mr. Doyle? Ms. Harmon? Ms. Harmon votes no. Ms. Schakowsky? Ms. Schakowsky votes no. Mr. Gonzalez? Mr. Inslee? Ms. Baldwin? Ms. Baldwin votes no. Mr. Ross? Mr. Ross votes no. Mr. Weiner? Mr. Weiner votes no. Mr. Matheson? Mr. Matheson votes no. Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor votes no. Mr. Sarbanes? Mr. Sarbanes votes no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space votes no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley votes no. Mr. Welch? Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shimkus, aye. Mr. Shadegg? Mr. Blunt? Mr. Boyer? Mr. Boyer votes no. Mr. Radonovich? Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Pass. Ms. Bono Mack passes. Mr. Walden? Mr. Walden votes aye. Mr. Terry? Mr. Terry votes aye. Mr. Rogers? Mr. Rogers votes aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Votes aye. Mr. Murphy of Pennsylvania votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes aye. Mr. Scalise? Mr. Scalise votes aye. Mr. Radonovich? Mr. Radonovich votes aye. Ms. Bonomack? Ms. Bonomack is off, present, pass, and on aye. Mr. Rush? Not recorded, Mr. Chairman. He's over. Mr. Rush votes no. Mr. Inslee? Mr. Inslee votes no.
Have all members responded to the vote? Clerk will tally the vote.
On that vote, Mr. Chairman, the vote was 14 ayes and 31 noes.
14 ayes, 31 noes. The amendment is not agreed to. Clerk will report the next amendment.
This is a vote on the amendment offered by Mr. Boyer, number 011.
Clerk will call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Dingle? No, wrong one. Yeah, I know. Mr. Markey? Mr. Boucher? Mr. Boucher votes no. Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Gordon, no. Mr. Rush? Mr. Rush, no. Ms. Eshue? Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Inslee? Mr. Inslee votes no. Ms. Baldwin? Ms. Baldwin votes no. Mr. Ross? Mr. Ross votes no. Mr. Weiner? Mr. Weiner votes no. Mr. Matheson? Mr. Matheson votes no. Mr. Butterfield? Mr. Butterfield votes no. Mr. Melanson? Mr. Melanson votes no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Mr. Hill votes no. Ms. Matsui? Ms. Matsui votes no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor votes no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley votes no. Mr. Welch? Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shimkus, aye. Mr. Shattuck? Mr. Blunt? Mr. Boyer? Mr. Boyer votes aye. Mr. Radonovich? Mr. Radonovich votes aye. Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden votes aye. Mr. Terry? Aye. Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Sullivan, aye. see you. You're hiding. Mr. Murphy of Pennsylvania votes aye. Mr. Murphy of Pennsylvania votes aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn votes aye. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Scully. Mr. Scully votes aye. Mr. Welch. Mr. Welch votes no.
All members responded to the roll. Call of the roll, yes. Mr. Gonzalez, how do you vote?
Mr. Gonzalez votes no.
Any other members wish to be recognized? If not, the clerk will tally the roll. Hold it. Hold it.
Mr. Dingell, no. On that vote, Mr. Chairman, the yeas were 17 and the nays were 33.
17 ayes, 33 noes. The amendment's not agreed to. Clerk will report the next amendment to be voted on.
Oh, God. This is an amendment by Mr. Rogers, number 002.
En bloc?
Yes, sir, that is the en bloc amendment.
Okay. Clerk will call the roll.
Mr. Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Markey. Mr. Boucher. Mr. Boucher votes no. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Gordon votes no. Mr. Rush. Mr. Stupak. I'm sorry, I skipped one. Hang on one second. Ms. Eshue. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Engel, no. Mr. Rush. Mr. Rush votes no. Mr. Green. Mr. Green, no. Ms. DeGette. Mrs. DeGette votes no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon votes no. Ms. Schakowsky. Ms. Schakowsky votes no. Mr. Gonzalez. Mr. Gonzalez votes no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross votes no. Mr. Weiner. Mr. Weiner. Mr. Weiner votes no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow votes no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen votes no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton votes no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Stearns. Mr. Stearns, aye. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, aye. Mr. Shattuck. Mr. Blunt. Mr. Brewer. Mr. Brewer, aye. Mr. Radonovich. Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy of Pennsylvania? Mr. Murphy, Pennsylvania, aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Anybody miss? Okay. Mr. Dingle. Mr. Dingle. Mr. Dingle, no.
All members having responded to the vote, clerk will announce the vote.
On that vote, Mr. Chairman, the yeas were 18 and the nays were 33.
18 ayes, 33 noes. The amendment's not agreed to. Have we completed the all the amendments?
No.
One more.
One moment, Mr. Chairman. I have one more. The Rogers Amendment 008 was a roll call was requested on that.
It prohibits the use of funds. Yeah. It prohibits the use of funds. Clerk will call the roll.
Okay.
This is the last amendment, then we'll proceed to final passage.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Dingle votes no. Mr. Markey? Mr. Boucher? Mr. Boucher, no. Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Gordon, no. Mr. Rush? Mr. Rush, no. Ms. Eshue? Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Matheson, no. Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Stearns? Mr. Stearns, aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shimkus, aye. Mr. Shattuck? Mr. Blunt? Mr. Booyer? Mr. Booyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy of Pennsylvania? Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye.
Have all members responded to the roll? Mr. Murphy? Mr. Murphy votes aye.
Mr. Murphy of Pennsylvania votes aye.
Clerk, ready to report the vote?
Yes, sir. Mr. Chairman, on that vote, the yeas were 19 and the nays were 33.
19 ayes, 33 noes. The amendment's not agreed to. The vote now comes on reporting the bill from the committee with the usual instructions, and the clerk will call the roll for final passage.
Mr. Waxman?
Aye.
Mr. Waxman votes aye. Mr. Dingell? Mr. Markey? Mr. Boucher? Mr. Boucher, aye. Mr. Pallone? Mr. Pallone, aye. Mr. Gordon? Mr. Gordon, aye. Mr. Rush? Mr. Rush, aye. Ms. Eshoo? Mr. Stupak? Mr. Stupak, aye. Mr. Engel? Mr. Engel, aye. Mr. Green? Mr. Green, aye. Ms. DeGette? Ms. DeGette, aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Ms. Harmon? Ms. Harmon, aye. Ms. Schakowsky? Ms. Schakowsky, aye. Mr. Gonzalez? Mr. Gonzalez votes aye. Mr. Inslee? Mr. Inslee, aye. Ms. Baldwin? Ms. Baldwin votes aye. Mr. Ross? Mr. Ross? I know. Mr. Ross, aye. Mr. Wiener? Mr. Wiener, aye. Mr. Matheson? Mr. Matheson, aye. Mr. Butterfield? Mr. Butterfield, aye. Mr. Melanson? Mr. Melanson, aye. Mr. Barrow? Mr. Barrow, aye. Mr. Hill? Mr. Hill, aye. Ms. Matsui? Ms. Matsui votes aye. Mrs. Christensen? Mrs. Christensen, aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes, aye. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, aye. Mr. Space? Mr. Space, aye. Mr. McNerney? Mr. McNerney, aye. Ms. Sutton? Ms. Sutton, aye. Mr. Braley? Mr. Braley votes aye. Mr. Welch? Mr. Welch, aye. Mr. Barton? Mr. Barton, no. Mr. Hall? Mr. Hall, aye. Mr. Upton. Mr. Stearns. Mr. Stearns, no. Mr. Deal. Mr. Deal, no. Mr. Whitfield. Mr. Whitfield, no. Mr. Shimkus. Mr. Shimkus, aye. Mr. Shattuck. Mr. Blunt. Mr. Boyer. Mr. Boyer, no. Mr. Radonovich. Mr. Radonovich, no. Mr. Pitts. Mr. Pitts, no. Ms. Bono Mack. Ms. Bono Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, no. Mrs. Myrick. Mr. Sullivan. Mr. Sullivan, no. Mr. Murphy of Pennsylvania. Mr. Murphy of Pennsylvania, aye. Mr. Burgess. Mr. Burgess, no. Mrs. Blackburn. Mrs. Blackburn, no. Mr. Gingrey. Mr. Gingrey, no. Mr. Scalise. Mr. Scalise, no.
Have all members responded to the call of the roll? We have one more coming, so don't, we're not closing it yet. Mr. Dingle?
Mr. Dingle, aye.
Okay, and there's one more we understand coming on the Republican side.
I'm told Mr. Shattuck is on this one.
Clerk can do a preliminary count, and then when we find out how this next member votes, then we'll have the final tally.
At this time, the vote is...
Well.
Are you all right? Okay.
Just so you're ready.
Is he not there? He's not out there. So you can...
Okay, clerk will announce the vote.
On that vote, Mr. Chairman, the ayes were 39 and the nays were 13.
39 ayes, 13 noes. The bill is reported out of the committee with the usual instructions. That concludes our business. We stand adjourned.